Okay. Good morning. Today is the regularly scheduled meeting of the Board of Selectmen. It is Tuesday, January 20th, and it is 8:34 a.m. In front of you, you have this morning's agenda. Do I have no additions or corrections from me? If not, if I could get a motion to approve the agenda?
So moved.
Second. It's unanimous. And then the regularly scheduled meeting minutes from January 6th. Any additions or corrections there?
None here.
In here. Okay, if I could get a motion to approve.
So moved.
Second. It's unanimous. Public comments. Members of the public are welcome to provide comments to the Board of Selectmen on agenda topics scheduled for review and or vote. Comments submitted electronically should be sent to the following email address: bosdistribution@newcanaanct.gov. Do I have anyone wishing to address the board? Seeing none, if we could move on to our budget review. I guess the first group up is Health and Human Services. And are you coming together separately? Whatever you'd like. Do you, how are we doing this? Let's see.
You got to turn those mics on too.
Like to hear from. Well, I'm looking at a health department. Is this, Amy, this is your first?
This is my first
budget
yes.
presentation. Right. So
no pressure.
A weekend. Nothing like a 3-day weekend.
Oh no, I'm sorry.
Good morning. I'm here to present our health department budget for the fiscal year 27. Just quickly, our health department staff, we have myself as the director of health, Dr. Jamie Riskowski is our medical advisor. We have Deborah Katz as our administrative assistant, phase 1 sanitarian. Shannon Valerie is our sanitarian health program. Our newest employee, Kelsey McCarthy, as a sanitarian health program planner 1, and our part-time public health nurse, Ellen Samai. So some of the responsibilities of the health department are environmental health, community health, healthcare services, emergency preparedness, and partnership and community improvement. And through all of those responsibilities, we strive to do the 10 essential public health services, which you can see in the table. So we are constantly doing surveillance for diseases, communicating to the public, and then doing our inspections for our enforcement actions as well. So just to dive deeper into some of those responsibilities, our environmental health responsibilities include all food service establishments within the town of New Canaan. There's currently 106 food establishments.
Did you say 100 and? Okay, wow.
Those establishments are inspected anywhere from 1 to 4 times a year, depending on what kind of food they're serving. We also are responsible for private and public drinking water wells and systems. There are 5 public water systems in New Canaan, and we do about 60 well permits a year. We also are in charge of subsurface sewage systems. We issue about 90 permits a year and review building permits associated with properties on septic systems. We license salons. There's about 43 salons in the town of New Canaan, and we do inspections of those once a year. We also license public pools. There's 22 of those, and we inspect those once a year. We do daycare inspections at the request of the daycare centers. We deal with any rental housing issues that may come up, and we also deal with complaints ranging from hoarding to rodents and garbage.
Can I ask you a question with the permits, the sewage system permits? If someone has to redo their septic, do you have to get a permit to fix it? Okay.
You usually get multiple permits, not just one. So you'd get a soil test.
Yeah, so it's not like we're having 90 new pieces of construction. It's people.
They're either repairs, new tanks, or things like that.
Thank you.
We also do community health programs. So we do educational programs such as Question, Persuade, Refer, which is our suicide prevention program, which we offer once a month in the library. We're doing monthly programs at the Lapham Center and Schoolhouse on a variety of different topics. And then we hold panel discussions throughout the year on different topics. We also issue guidance with social media messaging, and we are doing tick testing and education in our office. Our nurse does health screenings at both Lapham and Vine Cottage. The screenings are for residents and employees, and we're looking for things like blood sugar, pulse ox, and A1Cs. And then we also are a member and participant of the child vaccine program through the state of Connecticut, so we can give free vaccines to children who need them to enter school. So these are some of our performance indicators. I'm not going to go through them all because I kind of touched on the main ones of the 106 restaurants and salons and pools. And then some of our accomplishments, we expanded our community health programming to include monthly community trainings on different health topics. You can see in October, we did a health literacy trying to navigate facts from misinformation that we're seeing out there right now. We refined the online permitting process for OpenGov. We assist with Medicare Choices Counseling at the Lapham Center. That's Shannon Valerie, she's one of the counselors. We've expanded communications to residents through our Everbridge notifications and our social media pages. And our goals are to collaborate with other agencies and organizations to address community mental health concerns, to utilize social media platforms to showcase past public health accomplishments and increase awareness for residents for what the health department does, and to promote ongoing professional development by encouraging staff to obtain relevant certifications and participate in advanced training programs. So these are our revenue projections. I provided the average and the median from 2021 to 2025, and then based on those average and medians is how I came up with the numbers for 2027. And then these are our expense projections. Overall, we're down 6% for the department for the year, mostly due to salaries. So the summary of the change requests for this year, our increases are our part-time salary line. Our public health nurse is currently at 12 hours a week, but the grant that I have is funding her for part of that. It ends at the end of this fiscal year. So to keep her at the same amount of hours, we increased her salary in the budget. We have a training line for a staff member to obtain a health wellness coach certification. So this would allow one of our staff members to help people who get health screened for different health conditions to achieve their goals and lower their numbers. We added a car repair line just because I like to be prepared. And we did a program meetings and expenses for our education events and programs and for items that are distributed at those programs. Our decreases are our salary and our overtime lines, our service contracts, because we reduced the number of Bluebeam subscriptions, and then office equipment, office supplies, and medical supplies.
And how were we able to reduce the number of Bluebeam subscriptions?
We just told Bluebeam we just wanted one.
Okay, so you can all share.
Because we don't use it very frequently, so.
Okay, how many did we have before?
3.
Oh, wow. Okay, thank you.
Thank you. And is there any discussion or questions?
Well, I guess given the where we are in cold flu and every other season, I mean, do you feel like you have all the resources you need to sort of manage the department? And you've given us thank you for the 6.4% decline in your budget. I always love to see those numbers, but we also want to make sure feel like you're going to be appropriately resourced for the coming year. So
I think we have enough resources to address whatever needs come up for next year.
I think we get a lot of bang for our bucks in funding this. I mean, so, your budget is for 545, but you're bringing in almost 170,000 of that. And, what you do for the town. I mean, just think about it, just making sure all those food places are up to snuff. And, it's 106 of them, but it's like 450 visits. I mean, with a pretty lean staff. So I appreciate what you do, and I think it's a great value to the town. And I really think you have a particularly important role right now, given how difficult the information and misinformation stream is in the world. So it's great to have pros to talk to.
Agree. Did you say 22 pools? Is that include
22 public pools.
So that clubs too? Is that like a separate pool?
No,
Public, I know.
I'm trying to count them.
22
a lot of condo complexes. They're
because we're
considered
just like,
yeah.
I'm in the sphere of the town, and I'm like, where the heck are?
Yeah, no, condos are considered public because they're.
Got it.
That makes sense. Thank you for asking.
Yes, I was thinking the same thing. I just want to give a shout out to all the health efforts that you're working with the HR department on rolling out for the staff. I mean, I just went last week and got my blood pressure and my blood sugar. And
Season, no less.
yeah.
You know, given
I am
him
in
just
good health.
just checking. It depends when the meeting was. Yeah,
I was
okay.
in good health. I felt good. As someone who's been a little sick this year, it's been good. But I think there was some identification of employees that needed some intervention. So it's early intervention is great. So thank you very much for the partnership, and Amy's been a great addition to the staff. So thank you for all the work you've been doing and sort of helping the town move in the right direction. So
Yeah, I'm impressed with the first budget presentation, really.
Oh, thank you.
Very nice.
Tried to keep it
Was.
short.
Come on, she won the door competition. This girl was prepared.
all right. Well, if you have no other questions, you want to move on to human services with Marcy. This is Marcy's second budget presentation, right?
Yes, it is. I just have to,
Hold on.
you have to unshare.
I know I have to find the button.
Hold 1 second.
Okay.
It says somebody else.
Yes. So Amy's,
Oh, allow?
Stop sharing.
I'm trying to, but I don't know where the button is.
Do we have this on our tablets?
Thanks a lot.
It's on our tablets?
I sent it to Ryan. I don't know.
Oh, you sent it to Ryan.
But that's,
Oh.
he told me to.
Pam, yeah. Send it to Pam as well.
Oh, I'm sorry. My second time
Right.
around and I.
We have the numbers in the book, so.
So everything, hi everybody. Everything is on the tablet. It's in, if you remember from a couple of weeks ago, it's in that budget folder all
that's
the way.
right.
You have to get out of the meeting folder all the way to the bottom.
That's right. Budget in 26-27 budget material folder.
Wow, that sounds like the voice of God.
Sorry about that.
Right. Does everyone know about at the very bottom? Go back.
I couldn't even get out of it.
Go down. Keep going.
I don't know where
To
it
the
went.
very bottom. Have we shared before we start? I mean,
Sharing.
does everyone know Ryan is a new dad? I mean, he's already now he's got two.
Congratulations, Ryan,
Congratulations.
wherever
Hey, way
you
to go.
are.
Yes.
Thanks
Can't
very
wait.
much. I'm tucked away in the second bedroom in the house, trying to make everybody, we're sick. Everybody's sick here too, so that's not helpful.
Oh,
But yeah, we're
no.
doing well. Yeah,
Oh.
even the 2-week-old is sick, so
Oh,
past couple weeks,
a
but
lot of stuff
It's
going
happy
around.
news.
A lot of stuff. Okay.
exactly.
All right.
We
But
found
thank you.
We found it. So
So good morning, everybody. This will be a hard act to follow on her first budget, but this is the New Canaan Human Services Department budget request. Our mission is to help all New Canaan residents function optimally by developing programs and activities that address developmental needs and assisting residents in obtaining appropriate social services and resources. Our caseload, as you can see I only went back to 2024, but year to date, my adult and senior clients are 228, and Jackie's youth and family are 169 families with 178 youth. So those numbers, we project those will be going up a little bit more since this is just a year to date number. My Life Reimagined group, as well as my grief support group, year to date, 84 and 384 attendees. So
What is Life Reimagined?
Reimagined is a group I hold at Lapham, and it's for sort of newly retired, questioning what's next and finding purpose.
Got it.
And the grief support currently is loss of a spouse. I am going to be starting some new groups at Lapham, a Parkinson's support group, as well as a caregiver support group. That will start up in the spring. So those numbers aren't in here. Next page, the state resources we have access to, that we help our clients have access to, are through the Connecticut Department of Social Services, the Social Security Administration, Southwestern Connecticut Agency on Aging, SNAP, Department of Children and Families. I do a lot with Adult Protective Services. We help with Medicaid. We are choices counselors, and we help with all state health insurance programs. The New Canaan Food Pantry, our participation, as you can see, our numbers are going up. Year to date, we have 945 household individuals. Last year, we had 1699. So I think we're looking at close to 2,000 this year. And then shoppers coming to the food pantry, we are at 740. Those are the people who come and shop for families. And we've had a lot of people who've been sick, so people will shop for a sister or a mother. So those numbers are a little bit down, but that's just heads coming into the room to shop for people. So that's why that number is a little bit down.
So do we add those together to get an idea of how many people use it? or-
The how many people use it really is the household individuals.
So a family of 4 would be 4
Right.
versus, let's say
Versus
the
just a
mom comes to
shopper.
come shopping, that's 1. So they'd be independent numbers.
The programs, I don't need to read through all these. You guys have gotten the chance to read them. I do a lot of, like I said, work with protective services. I have conserved 2 people year to date. We help with back to school programs. Like I said, we are choices counselors. We will do emergency response when needed. I am a mental health first aid trainer along with Shannon at the health department. So we are going to be doing a mental health first aid training. I'm doing one the beginning of February with Darien. I wasn't sure when Shannon was going to get certified. So we're sharing, and then we're going to do one in March. So we're going to try to do these quarterly and offer them not only to town hall, but to first responders, to the library, to anyone who deals with.
Can you explain what you're doing? I'm a little confused.
Mental
what you're-
health first aid.
No, what you're doing with Darien.
So there is a mental health first aid trainer there, and
Okay.
mental health first aid training insists on having 2 instructors at all
Okay.
times. So
Okay.
we weren't sure when Shannon was going to be
Okay. I see what you're saying.
certified. She did, but it was after
You'd already agreed to do that.
So
Okay. Okay.
we're collaborating with Darien
Okay.
just this once.
Marcy's from Darien, just so you know.
So these are our outside agency grant requests. Should I just admit, Peter? Or, we have an opioid line, and we have a youth services grant. So I tried to sort of creatively stick with what was needed while keeping an eye on our budget. The Get About requested 65,000. They are going to get 50,000. 25 will come from New Canaan, and 25,000 will come from the Connecticut DOT grant. The Domestic Violence Crisis Center requested 10,000. That will come from the town, 10,000. Hang on. Why can't I do this? Anyone have an idea?
Oh, it's not moving?
Nope. Okay. Oh.
Yeah.
How did I?
You- Oh, it's going
It's
like
only
that.
letting me do it with my hands. So,
Ooh, which is always dicey.
oh my God.
Can you use the up and down arrow?
It wouldn't let me.
Oh.
Okay, so here we go. New Canaan Cares. After looking at their money and all the wonderful things that they do, they did request 22,000. We are going to keep that at 18,000. The award is going to be 2,000 from New Canaan, 10,000 from the Youth Services Bureau grant, and 6,000 from the opioid settlement. So the budget line will read 2,000. So there has been a decrease there, but they will still be getting their 18,000. Meals on Wheels.
Oh, that's what they got last year.
That's what they got last
It's
year.
not a
yep.
decrease from what?
No, it's not a
It's
decrease.
the
I
same
will show
amount.
you on the next
How long
page.
is that grant in place? Both the opioid side?
SB grant is always
Okay.
until the state says otherwise.
Okay,
And it's approximately 25,000 a year. Sometimes they will give us a supplemental amount and we never know what that is.
Okay.
So I'm just going to work off of the base
sure.
grant right now. And then our opioid money is coming, it looks like until 2039. And do you know exact, what in Munis it says 2039 or something like that. Oh, okay. So now it's 2041, but
Yeah.
and we get a.
So we'll have this grant money available for
We
multiple
will,
years. We're not gonna have a big hole next year.
Right,
doing this. Great.
right, never,
great.
no. And we have currently about 90,000 in it.
Yeah,
So
and
we are
Marcy and
able-
I talked about, because it's hard, like with the YSB grant, it's very specific about what you can use it for. So it's, it makes sense to use it and plan for it because, we're always kind of like, well, we have this money coming in. What are we going to use it
Yeah.
for? You have to use it for something very specific. And if you don't, you lose it.
Right.
So,
No, that's perfect. I just wanted to make sure when we reflect it
Yep.
this way, that the following year, we're not gonna go, we
Right.
have to come up with this money. So we're in
Right.
good shape.
really in good shape. I looked
Great.
at, like, and we get approximately like 25,000 a year from opioid.
Okay.
And we have
And-
some in
and
the
we,
account.
we did talk about how, when it goes away, it's going to be a budget jump and we'll have to have that conversation.
Right.
But like, you don't
But
over
it's,
budget.
yeah, but it's
to not
not
use.
for quite a while.
Right.
It's not like next year.
Correct.
So we're good.
Correct.
Okay.
Meals on Wheels is going to be getting 5,000 from the town. And then the New Canaan Urgent Assessment Behavioral Health, that is, they requested 40,000. 15 will come from New Canaan, 25,000 will come from opioid settlement. And a total for all these outside agencies will be 123,000, but it'll be considerably less from the town, out of the town budget. I'm sorry.
Marcy, those last two Meals on Wheels and New Canaan Urgent Assessment, they asked, where are we year over year there? Same?
That's
Flat?
same
Okay.
from last year.
Any idea of their utilization? Urgent
The
assessment?
amount of, it really depends. It depends. They're doing a presentation to town
Okay.
council. Numbers go up and down and I think that's seasonal, it depends on stresses. And
I saw a chart for the last 3 years, I think, and it like spikes and it goes way down and then
Yeah.
it spikes and it goes way down. And, it's,
Yeah, I'm just,
Yeah.
I
don't
just
see- I
making
don't
sure
see
it's a
a
resource
growth.
that people are tapping.
Yeah.
That's all I'm saying.
yeah, I haven't seen the spikes getting higher.
Okay.
So like in the chart that I saw, the spikes are not getting higher.
Okay.
So that's encouraging, I guess, in that the
Yeah,
spikes
no,
aren't getting
Right.
higher,
I
but
mean, it's doing what it's doing.
unless people aren't using.
I guess it's two ways
Yeah.
thinking about it.
Yeah.
Is there more reach that they could do? Or
Yeah.
is it well staffed for what is needed? It's
Yeah.
hard to say, right?
That's all gonna be part of the presentation.
Okay, thank you.
Well, and we have other resources, like a number of the staff now, we went to visit, it's not an urgent assessment or a assessment program like within 24 hours, but a number of us went to the old Hallbrook,
Yeah.
Hallbrook
St. Vincent's.
so that's part of St. Vincent's Hospital in Westport. And they do a lot of work with the mental health issues that we're facing, and was very impressed with the facility. And so it's another resource for Marcy and the community
To direct people.
to direct people. So I think you're seeing more. I remember when I was first, like 3 years ago, went to visit Stanford Hospital. It still hasn't really come online, it seems like, but they're going to have more beds eventually. I feel like I was listening to something the other day where that's been a little bit delayed in coming online, but that they're going to take the old section of the hospital and convert that to a youth beds for the mental health challenges. So,
Okay, thanks.
So our expenditures, really the only continuance that I am asking for is the general assistance that started last year. And I'd like that to continue, the 15,000 that we use for rent and utilities, et cetera. We have used to date about 12,500 of that. So it's definitely used and needed. We were stockpiling that for a while, so we are down to about $20,000 in there. So the 15,000 will absolutely help with that. I don't know if you guys have any other questions on any of the expenditures. I am going to top Amy on the fact that we are down 8.9%. If this is a contest.
That savings is in the part-time salaries? Is that where that?
We got rid of a part-time salary line, and our postage has gone down because with energy assistance, we can apply online now. So we don't send these big folders of paperwork to, and that's really kind of it. on
Just
that.
with your general assistant line, I think you said you've used, is it 12.5 year to date?
Yeah,
But so you have kind of like, I think you said you stockpile it, so you're, so
we did a couple of years ago.
Okay.
I
So there
was
was
not
a
part of that, but
balance
there was
there.
like a
They
we're drawing down the
balance.
balance, and now, so you think you need about 15 a year to help people out?
And you know what, can you just, because you mentioned it in our meetings, but talk about the software subscription?
Yes, so we are moving from a software that's called Virtual Case Manager to a software that's called Charity Tracker. That should also, it's less expensive and it will help us with like numbers and stuff. Charity Tracker will help us tell you exactly who we're seeing, how we're seeing them, what we're seeing. VCM is not user-friendly. It's archaic. In fact, they are not even able to give us our information, and we can't put it into Charity Tracker. Like, they're so old school that we have to print out everybody
Wow.
and put,
Is that where there's no previous line for software subscription and now there is one, we've had it?
right. We did have it. I don't know. I think we've renamed that.
It was in different spot? Okay.
You'll see throughout budget working out, move it and it goes to the state.
All right. So I'll see this bunch.
Yeah.
And Marcy, Deanna asked this before, but I'll ask it now about the coverage, and you're thinking everything, you've got everything covered for the year. You don't feel like, whenever I see it down 9% and you lose a person, you think you're okay for the
Yeah, no, we're doing really well. Like, we have figured this out, and
people are finding you where you are, and
finding us, and we're like a well-oiled machine. I mean, I think if Jackie were to decide to leave or something, then you may be visiting me,
good. That's
a
great.
padded room somewhere. But right now we're good.
Good.
We're lucky. Our outside agencies, like I said, creatively, they are going to be funded. They'll be funded for everything that they've asked for. However, total out of the town budget will be 57,000 rather than the full 123. So that is down 56% using this opioid money and the youth services program. And that is it. The end, folks.
Right.
Thank you.
Thank
Any
you.
questions?
Great job.
No, great job.
Year two.
All right. So with that, if we could move on to EMS. I'm sorry. Do you want me to move somebody in front of you? I'm happy to do that.
Yes.
Okay. Whatever you, I'm making it easy for you, whatever works for you. Like, I want out of here. All right, web page. I miss Ryan's little, do you have Ryan's cheat sheet?
Yeah.
What page is that? Yeah, I think I lost it. Oh, it's in here.
Yeah.
It's in the front. It's something in front of it. Okay. So
So,
not only is John a member of the EMS, he's also a commissioner on the Health and Human Services Commission. So
it was good to listen to the RCNT.
yes, in the never ending, 90% of the, 90% of the work in this community gets done by 10% of the.
Yep.
John, you do more than your fair share. So
Oh, just everyone does. We're all just.
no, not everyone does. That's very generous of you.
So John Knight, I'm treasurer at EMS, and for our budget, 3 of the lines come from us. 1 line comes from the Southwest Regional Communications Center, and then the rest of them come from the town as allocations, given that it's a town-owned building. And the rest. So the first line item is the paramedic contract, and just as a reminder, that's a 5-year contract. We're currently in year 3. Next year for the fiscal year, it'll be year 4, and it's a fixed price per year. There's no cost of living increase. So it's the $465,000. The one thing that was a little bit new for us starting last year was that they are able to get reimbursement from us for their paramedic supplies. And initially under the contract, we were buying some things and they were not billing us for other things. So we weren't really sure how much that was going to be, but looking at it from October 2024 through December 2025, it averages about $712 a month. And so this comes up later because we've just asked for a slight increase in our medical supply budget for 5%, but that's, we also just wanted to make people aware because when the paramedic contract is up for renewal in, I guess, 2 years' time, we'll think about whether we have greater visibility on what those expenses might be and whether we need additional funds from the town or not as part of that. Yes. So the 465 is the same. The next line item for us is it's called repairs mobile equipment, but that's really vehicle repairs and maintenance. And the amount, we're proposing a 3% increase in our piece. To give you an idea for us overall, in fiscal year 25, we spent $54,000 on vehicle repairs and maintenance. This year we've budgeted 40. We have a new ambulance which will be coming on in end of February, beginning of March, but some of the additional expenses last year were because of the older ambulance.
So, wait,
if you look at, it's called repairs mobile.
no, I know, we only see 10,000 in the budget.
The rest of it we pay for ourselves.
Okay,
Yep.
Okay, great.
Yep.
I was like, wait, I only see 10, so I don't understand.
To give you an idea that
Okay.
while we get money from the town,
Yep.
it doesn't equal what we actually spend.
Okay, okay,
Just to give you greater visibility on
thank you.
the operations. The next line is the information services, and that's the contract with the Southwest Regional Communications Center for dispatching and tracking services. There are 2 contracts. We have an update on the number because they've actually set it. What they do is they figure out their budget for the year, and then they divide it up among all of the towns and cities that are covered. There's apparently a letter that's coming to you, Deanna, which will set it out, but it's the number is 64,875. So it's actually just a 0.6% increase from last year's budget. So less than the 3% that we were guessing at.
Oh, okay, so this will be, tell me that number one more time.
So it's 64,000. The total is 64,875 for information services.
Oh, wait, so we have, okay, so you had about,
We anticipated a 3% increase and it's only going to go up 0.6%.
okay.
And it's 2 numbers which are combined here. So there's a
Oh, the 7, wait, Is it the 762 plus the 60? What is it?
No, sorry. This is, they're,
This is your stuff. This is partly you fund part of it.
no,
Again?
sorry, I'm being, so the information services, there's two contracts and the number here is the combination of the two contracts.
Okay. And so
there's-
that's all on the town side. Okay.
There's a
So
letter that's coming to you
the
that,
number I have is 66,413 in my budget book.
yes, and the reason that is that we took last year's number.
Yep.
And we anticipated a 3% increase.
Okay.
And we were just informed yesterday of what the actual number will be,
And so that number is 64,875.
875.
And you have that, Ryan? Can you hear that? Or Ann?
I'll
I
email
do,
it.
yep.
Okay, great.
And you'll also be getting a letter because they'll
Okay.
send it to you.
Okay, great.
And there's two charges that make that up, but then that's the aggregate number.
Okay, great.
There's a CMed charge, Ryan, there's a CMed charge of 25,699. And then a dispatching charge of 39,176.
That number literally came over to us like 2 days ago, so
Okay,
that's why
great.
it's.
But
It's
it's
early.
less than we anticipated, so that's good.
We're happy when those numbers come in lower. It's okay.
Okay, good.
And then
And these numbers don't usually come down lower, so
Yeah.
it's nice to see that one did.
And then the medical supplies, we're proposing a 5% increase. In a sense, 3% was just with sort of inflation, and then the 2% was contributing a little bit toward the paramedic supplies that we now reimburse for Norwalk Hospital. To give you an idea, in 24-25, we spent $129,000 on medical supplies and equipment. Some of that's replacing equipment. So we have things like power loaders, stretchers, the life pack that the paramedics use. If that gets replaced, it's a $35,000 to $40,000 item. So this year we've budgeted for ourselves, just to give you an idea, around $83,000, $84,000. And so, and that does not include additional expenses that we have, like in outfitting the new ambulance. We have the radios that we purchase separately. We have the power loader we purchase separately. So,
You know, just as an observation,
Oh.
it would be really, I think people would really understand how much you all support this. If you keep saying, oh, you know, it's this much money, but you're only paying 6,000 in the town, it would be, I would put the entire expense that the whole program is, and then what percent the town pays. So I think people would be really amazed how much is self-supported by you. And I would advertise that. I think it's because you keep saying it's a $40,000 expense, but it's only 10. You know, so
part of it is I've inherited it because historically, when we've contracted for the ambulances, these things were dealt with separately, or when the old ambulance was sold, we would get a credit from the manufacturer when we put these new things in.
Yeah.
And some of them don't line up properly. So what we're trying to do, like with the new ambulance that we've just purchased, the one that we're paying for now, which is going to be delivered in 2 months, the amount came in 14,000 over what had been budgeted by the town. So we wrote a check for the difference. And then when 353, the old one, is sold, we're hoping to get that back.
Right.
Along with some other things. So,
fluid. Yeah.
so we're trying to figure out particularly with the capital expenditures for the new ambulances and paramedic cars, how to bring things in line, and also so that it's not a budget shock number, so that it doesn't go from, 280 to 380 or something like that. So we're trying to manage that, and through our fundraising, we're able to break even with our annual appeal, which is a soft appeal. So there hasn't been it's not like we're running at a deficit.
Right.
We're not making money, but we're not running at a deficit. And so we're just trying to be fiscally responsible, I think.
And our emphasis in our letter campaign, annual campaign, is the free service, the community, and what we bring as a volunteer ambulance corps to our community. We don't emphasize the fact that some of this is paying for the power loader, which isn't quite as sexy as the fact that we're giving this community service to our members, our community members. So It's, as John said, it's a soft ask, but we don't want to go too far into the numbers. They might question why the town doesn't pay for those things, but they're paid for by the donations of the people.
So
We're unique in having a free ambulance service.
Very.
I was gonna say, I mean, you
Very.
could ask the other side, like, most communities, you don't get ambulance care for free.
Right.
So I think, so those are sort of the 4 items. The other item that we have is a capital expenditure item, which is just replacing the paramedic SUV. They're sort of on a replacement cycle of, we have 2 of them and they have a 10-year life and we sort of replace one each every 5 years. Right now it's budgeted at 85,000, but we're going to try and get a more recent quote for the complete fit out of what it will be. So that we don't run into a similar situation that we just did where we were short. So I will check with Ryan in terms of your time frame for getting you an updated number before you actually vote or approve things.
So is the 390 that I saw in 25, 26, that came in at 4?
It's the one from before that.
Oh, even, jeez.
So that was the one we contracted for last year, but we don't have to pay for it until we receive it.
Okay, okay,
And so it was the 280
okay,
that was 3 years ago, which we're finally getting.
Okay.
294,
okay.
plus then the other things that we.
Okay.
That's a big pandemic shift.
Yeah, I mean, well, look at, we go from 294 to just budgeting 390 and you're not sure we're gonna pay. I mean, that's a huge increase and we're seeing that in all.
So that, I'll have any questions on the budget numbers, and then otherwise I'll let Barb give you just an update on us generally.
Update on us generally. Yeah, we are
Very buttoned up.
Yeah.
So as far as our core numbers, we are providing a class for training. We always do that in January through June. And that's filled with 20 prospective new EMTs potentially. A lot of those are, some are firefighters, some are high school students. We try and emphasize that the adult community members get first dibs on the spots in the classes, but we always seem to fill that. And so that's very promising. And we're able to fill our shifts with usually 2 full crews. And so we're in pretty good shape as far as numbers. Beginning of the pandemic, we had half the numbers. We had 26 people, I remember. And now we have, I think, 54. And so we just did a member survey to see how we can elevate the experience of the time you spend there. And we're kind of making a few enhancements, but they're pretty minor because generally the experience is very positive. People enjoy their crewmates. We try to connect people outside of your crew. So we're doing things like that, but that's all sort of soft enhancements. And so what John has just gone through are the things that we count on the town to do, and then we fill in the rest.
And obviously we
Culture,
just
the
finished
culture you guys-
celebrating our 50th anniversary last year.
Congratulations. The culture you guys have created there over the years is unbelievable. And I was going to ask, do people come to you or do you have to go seek the candidates? I mean, most organizations would have to go out and do heavy recruiting, but it seems like you have some natural,
Our ability to recruit members is usually based on word of mouth. And so I joined because I had a couple of friends that were doing it, and somebody hears about what we do, and we get a lot of friends of friends, or sometimes it's mom and child that take the class together, or the child takes it first and then the mom takes it. So it's mostly word of mouth, and people see what we do and want a part of it.
We are more proactively advertising for the class for it. So before it was more word of mouth, and now we're getting out and talking to all the different groups and meeting with people and promoting it. Yeah.
Good.
We're speaking at the Rotary Club in March, I think, and just to tell them what we do, and
Nice.
we're trying to do more community connectedness as well.
Great.
Well, I just want to thank and please, pass along to your members how much we appreciate all you do for the community. I mean, we're really blessed and, thank you for taking.
Thank you. No, we feel the support of the town and we all try to pass it along. Every meeting, we talk about how grateful our community is, and so do my best to pass it along.
I think a lot of people don't realize we are a volunteer service.
Yeah. We get calls, can I get my bill for this? And yes, we're volunteers, but we are trained as every other EMT in the world.
Well, thank you very, very much for all you do.
How has the new setup with the driveway at the police department, how's that going? Are you finding getting that?
It's
Okay?
good.
Yeah.
Good.
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 The construction was probably a lot.
Construction was challenging when we had to park the ambulances next door outside.
Yeah.
In the middle of winter. You forgot that.
Be smooth over there now.
Yeah.
I mean, that's great.
Absolutely.
Working
And
very well.
great partnership with FD and PD and
They're super supportive.
very helpful
very
on
helpful.
scene.
Yep.
PD is always there. We call fire if we need them. And
It's an amazing community.
And then they add to it, celebrating a 105-year-old resident last week at Schoolhouse.
On Thursday
It was
morning,
quite-
we did our
with party
drive-by.
hats and everything. I was very impressed. So
How fun. 105. Wow.
105, Rose Laviola,
It's amazing.
quite amazing. So, yeah. Anyway.
so
Okay.
we do appreciate the support of the selectmen as well. So
Thank you. Thank you for all you do.
Thank you.
And please, you can't thank the crews enough. I mean, the work they do is amazing. So thank you.
All right, all set? Thank you. All right, next up is police. Oh,
You didn't miss anything.
John, I said I was like, I was gonna let him wait and go after. He's like, no, I'll do the numbers and Barb can. Take care.
Morning.
So this will have assumptions. Okay, thank you.
Same thing with fire.
Keep looking at 2027. I think that's a misprint, but
Same,
it's crazy.
same. I keep doing that. Yeah.
Messes me up every year.
Yeah.
Reiterate the ambulance crew. It's always astounded me in my 30 years how jewel of the town it is. All the volunteers, the amount of hours that they put in and have to put in is just amazing. And we have a great partnership with them, and what they provide to the community is just astounding. So. You guys ready?
Yes.
All right.
Go ahead.
So we're presenting the police and animal control budget. 27. We'll start with the animal control. The animal control budget this year is 93,491, and that's entirely the salaries and benefits for our animal control officer. And we've resurrected the dog fund. Last year it was eliminated from the budget, but we put it back in this year. It was an auditing thing that Ann could speak to, but you'll
Oh
see
my,
in
so where'd she go?
the next slides.
Okay.
Um,
Is Ryan on? Does he know sort of Ryan, do you know can you speak to the
I
dog?
know a little bit, yeah. So the gist of it is that it was moved into the general fund last year. And then my understanding is that the auditors don't want that because it has to be separate for various reasons. I don't know the reasons, Ann can speak to those specific reasons, but then we moved it to, it's in the town clerk fund now. So it's a little bit more controlled in there.
Oh, so it's not in the PD budget, it's in the town clerks, a separate line in the
Where's
town
in the
clerks?
The
The
22,000 or so, yeah, I think it's 22.9 it's in There's a page for it. I can tell you momentarily.
Okay.
Thank you.
The name of the fund is a little broad
That's a-
because I,
Yeah.
when I think of dog fund under police,
tags.
I mean, it could be, my mind went to police dog too.
Yeah.
So where,
Okay, Joe.
is this private
don't
money
want
or
these
is this
details.
public money? And that's the other thing. It's like, is this money that fees are being paid into?
So that this
So what
slide
page is
shows what I have for,
This is page 51, everybody, sorry.
51, okay.
51, 51.
Oh, license fees. There it is. Okay. So dog license fees, 24,000.
revenues that those two lines are the revenues that are generated from the.
Oh, so that's coming through the town clerk's office where you pay for a
Yeah.
dog license. Okay, that's clear.
Okay. So, and Ryan was helping us talk about the dog fund and how it was moved into the general fund. Now it's back out of the general fund into a specific fund. But it's run through the town clerks, and that is, I see license fees. Okay.
So a couple of years ago, in one of the audits, it was remarked to close down the dog fund. It was too small of a fund to keep open.
Right.
So we moved it into the general fund. But in keeping in the general fund, if we had more expenditures that we needed, we couldn't do anything about it because we have to go for a budget appropriation.
Okay.
So I talked to the auditors about what a better way to do that. So they said, put it in the town clerk fund under a different division, which means they can raise their budget whenever they need because they have the fund balance. So we've moved it into there. So it's in, I think, 2810, I think is the dog fund.
Yeah.
So we have estimates in there that they have the ability to move because there is a fund balance that's building up in that account. A piece of it goes to the town and a piece of it goes to the dog fund.
So with the revenues so what do we use the revenues for?
So there's two parts to it. There's the part that goes to the town that's straight into the operating fund, and then there's the part that goes into the dog fund. That covers the fees that we have to pay up to the state. It's been up to about 18,000 a year. So when people are paying for their licenses, a piece of that gets carved out that has to go up to the state, that revenue. And then the other expenditures can go against the cost of the animal control officer, different things that he needs in doing it. And there's some things for the
Now
town
I
clerk.
understand why you're talking about it, because I'm like, why are you talking about the
There's
dog fund?
postage, there's all different things like to mail out the dog tags, to buy the the licenses, should I say. So that all goes in there. And then if there's extra fund balance left over the years,
Yep.
you could, and we did that last year, the year before, we used it to go against the salary for
Okay.
the officer.
Okay.
So
So
you have-
now I understand.
Yeah.
Okay.
This is not a lot of money. If we're only bringing in
26 or I forget what it is offhand. It's in the 20 something $1,000. Yeah.
But 18,000 that goes to the state. Is that correct?
So I'm sorry. So if we're bringing 24,000, 18 goes to the state. Is this like a $4,000 or $5,000 transfer over? I mean,
No, it stays in the fund because they have to pay for the
tags and stuff like
supplies and
that.
the postage and all that. And then it flows up into the fund balance. It's identified. If there's any excess.
okay. And then that goes.
But at least then we're tracking the use once it grows. So it does grow over time. And so it was growing over time.
So we pull it down periodically.
Yes,
Is there-
yes.
is
And
the
we
way
can track it better.
All right.
Yeah, and there's not the fee to license a dog is not
It's $8.
It appears that it's very inexpensive, and most of the money goes to the state. So it's
Yeah, there's a
like almost like a
calculation that we
pass-through.
have to do every year.
Yeah.
It's September of every year. We have to do, the town clerk does the calculation, gives us how many she sold, and then we have to drop it into their format.
And how is the fee set?
By the state. So I don't know the breakdown, the $8, and there's pieces of like $2.
But the
per
fee,
year.
the state says you can only charge $8 for a dog licensing fee, and you can-
Yeah, they have specific ones, whether it's neutered, unneutered.
Okay.
The fee's
Oh, wow.
different
Yep.
based on the dog and
Alright.
the.
And the goal here is that you just know who the animals are in town. I mean, this is not trying
Yeah,
to
we're not
make
making
money. I
money.
mean, this is
No.
just like,
No,
so
no, it's,
this is like
yeah,
a public safety
It's-
thing that we know what's going on.
Right.
itself. Yeah.
Right. Right. Okay. Thank you.
thank you.
Discussion for 24,000.
I know.
Oh.
Well, was confused why John was making the presentation on dog fund.
Maybe we could add the word license there, dog license
Yeah.
fund budget. I don't know.
Could rename it.
Okay.
Better description.
Yes,
Um,
yes.
Quickly going
Dog
back,
fund just sounds funny.
the animal control budget, you can see that that is entirely his salaries and benefits. The other items we folded those over into the police operating budget, his vehicle equipment costs and the other supply costs. We rolled those over into our operating budget during our first selectman meeting. So I think that makes more sense. Insignificant numbers, so we just figured we put those into our operating budget.
Okay.
And then the next slide is the dog fund revenues and fees. Dog fund license, not our canine.
So that comes, that is interesting that it, and could we use some of that for the canine stuff or no? Yeah, for the dog, for the canine, the police canine, PD canine. Okay. Okay. Not that there's a lot of excess.
This is
And
not a lot of money.
no, and that dog is not, is a lot more than this,
It might be
than
his
what's,
food for a
yeah.
month or something.
Yeah. All right.
So that's all I have for animal
Okay.
control. Any other
Okay.
questions on that?
Sean's done a nice job. I mean, he's always out there. So
He's been great for us. Yeah. Moving over into police operating, you can see some of our highlights from last year. Answer over 14,500 calls for service throughout the year for services that we respond to. Moving into our operating summary, our operating request is 8.373, a 3.8% increase from last year. And you can see that budget, 87% of our budget goes to contractual obligations, salaries and for the officers. And you'll see in coming slides, I've got the utility costs and licensing and service contract fees are continually increasing.
We're in negotiations, right?
I think,
So
That we
you're in
budget-
negotiations,
I
right?
think did we budget 2%? We budgeted 2 in here. In the line, so 2's in there.
I think if you look at our overall,
I think some of it is because the salaries include non-union people. There may
Okay,
be
so
some-
the full-time salary, which
Right.
is proposed, all in is 2.8%, but within a union, we're budgeting 2%. Is that
Right
correct?
now, yeah,
Okay,
within
so-
the police budget, and then, yes.
Right, okay. Is there, and I know, when do we think the contract will be done? So
we
we'll-
have
will
a
we have
meeting
real numbers?
scheduled for this Friday and we're close to the finish line
Yeah, it's been going on for how long?
since June.
Okay,
July.
so we'll have that number before we get, hopefully.
We're pretty close. Yeah,
Okay.
I think we'll have it probably before the next budget meeting.
Okay.
We'll see how it goes this
Okay.
Friday, but we're very close. So hopefully we'll get there.
Thank you.
In this next slide, I included everything related to salaries, including overtime, the overall salary request. And back in FY25, we moved from 47 to 50 sworn officers. Large part of that was for the school resource officers, which is going well. You can see that we currently have 5 officers assigned to all of our public schools. Our newest school resource officer is at South School, Marie Castro. She's doing a great job. She started there in January this year.
Just met her last week when I was reading for the first grade class.
Yeah.
She's great.
And she's doing great. All of our other officers are doing a great job, especially at the high school and middle school. They have a tremendous workload and a tremendous relationship with the the students and the parents and the faculty and staff. So, we were given the directive that this was a high priority for the town, and we're maintaining that operational unit, and they're doing a great job.
Hey, John, can I ask you, can you go back 2 pages to the salary page?
Yes.
Thanks. The spreadsheet, yeah.
Yes.
So what's the top and what's the bottom? There's a break in your lines, okay?
Yeah, so the 5 at the bottom are just the overtime numbers that I'm going to talk about in future slides, so we can just see what the overtime costs are.
But you have those numbers up top too.
Yes. Yeah, I'm including them in a.
I was going to have a separate discussion. This is just pulling out. Okay.
Yeah.
I wasn't like adding it together. But thank you. Thank you.
Okay, in the category, we need to go back to dogs. And it's a small number, but why is the canine program up so much as a percentage basis? It's a small dollars, but it's like, why is it going up so much?
So that was because we had the donation account.
Okay.
It's about 15,000 a year to
Okay.
run the canine program, and we were using up all of that donated money that we used to solicit through GoFundMe's, and we got the direction from the Board of Finance and Town Council that we no longer wanted to fund that through donations. We wanted to just put that into our operating budget. So this is phasing it back in.
Okay.
So we're using up all of that remaining money that was donated, and now we're shifting to transitioning it into our actual operating cost.
Okay, great. Thank you.
A little bit more specifically about overtime. We've seen for FY25, we saw a 2.9% decrease in our overtime hours. Our scheduling software allows us to monitor it closely. And these are some of the largest drivers of overtime: shift shortages, training. We have different categories that help us identify where the overtime comes from. That we've got some significant decreases in shift shortages, and that's largely due to having full staff. One outlier, the second supervisor, was a significant increase from FY24 to 25. But in this current budget year, we've seen a trending decrease because of our officers have participated in promotional process. So in FY24, we had one officer that was eligible to work as an acting supervisor. This current year, we now have 7 officers. So that allows our shifts to staff supervisory vacancies with on-duty personnel rather than hiring back. So although this number was high in FY24 to 25, we're seeing a trend downward in that. So that's a good sign. But this scheduling software does allow us to get into there and granularly look at what is driving overtime. The administrative line, that's sort of a catch-all area where we put a lot of miscellaneous things. We are looking at that closely. We've identified some things that we want to carve out and create new categories for. For example, when officers are acting as instructors for training, typically they just put it in there as an administrative overtime, but we're identifying that out as a training cost. The other area is when officers have to go to workers' comp appointments, doctor's appointments, OT, PT. Those have been in the administrative category. We're going to carve those out so we can see what those costs are and perhaps get reimbursements from workers' comp in those areas. So this software really helps us get a good look at exactly what we're spending on our overtime and where it's going.
Chief, one of the things that we talked about when we added the SROs and added, more full-time officers was that the school year is shorter than the calendar year. And part of that was that the SROs might be able to cover some of those summer vacations and sort of fill in and backfill some of that time. Is that working out? Is that another reason why we're
that does help us through the summer months. Obviously, it's high vacation time. We encourage our SROs not to take time off during the school year. But they do come back to the shifts, their assigned shifts, during the summer months and vacations if they don't take the time off. The same as the schools, they'll come back to the shifts and work the shifts. So,
And that's a full day, right? For an SRO, they're there when school opens. And
they're
and they
full
probably
day or more.
Yeah. Okay. Yeah. All right.
Yeah.
So they're not coming back and filling in anything during that.
Not during the school year, school week. They're running full days, if not more, with meetings after school with staff or parents or kids. So they're running a lot. Yeah.
Okay.
And are you able to make sure they don't take vacation during the school year, or is that within?
We encourage them. I can't mandate that they can't take a day off during the school week.
And I know things come up, but in general, are we
In
finding that people are?
That's part of the condition when we interview the people for the positions. We make it clear to them what the expectation is that they're there while school is open.
And that's worked well.
It's worked. Yeah. There are times when they have to do mandatory training, or if they have to take a sick day or whatever, life comes up. But in large part, they do a very good job, and we put the right people into these positions, and that's something that I've mandated that we do, is that we're not just putting people in there that don't want to be into these positions. They have to want to be there, and they have to understand what the expectation is. And the expectation is that they're there when the school needs them, whether that's during the school day or if it's a meeting at night or an event on the weekend. They're very good at showing up when they need to.
And if during the week, I mean, not, so is it backfilled with somebody if the assigned officer is not?
Generally, because we have 5 officers, an officer will cover another school.
Will float.
Will float over. So if the resource officer at Saks is out for the day, we could have perhaps one from South School go over and check in. So we don't backfill them from the shift. We use them to cover when there's a shortage.
And just to clarify also what the chief's saying is they are also, they're considered a unit, so they're closely supervised by the youth sergeant. So they have periodic meetings with him as well. And when they're off, so he'll be approving their day off if they request a day off. So they have to go through a process to get a day off. So it is vetted.
Great, thank you.
And then those 5 overtime areas I carved out before just to show the increase from FY26. It was 560, we're going up to 569.8 this year. And that's largely due to the anticipated salary increases from the contract.
Chief, what does that number historically look like? It seemed like that's lower than some of the numbers I've seen over the years were much higher than that. So is that trending? Has that trended?
The overtime, like I said, it is trending slightly downward, and that's in large part due to the supervisory positions that we have in that area.
And that software seems like it's doing its work too.
It's helping us track that and track what our costs are. So, but the big driver of overtime is supervisory and shift vacancies. So when we get a long-term injury or absence or a vacancy for a supervisory position, that's what really hits our budget hard. But for this year, we've been trending in a good way. So hopefully it'll continue. To utilities and service contracts, some other big drivers of our operating budget. Expenses are coming down somewhat, and that's still to be determined what the new building is how it's gonna operate, but we are seeing some hopeful savings in those areas, some energy efficiencies. So hopefully that'll play out and continue to do well for us. And then service contracts has gone up significantly. Last FY26 revised was 129,850. We're asking to go up to 250. And you can see in the next slide here.
Backing up, the utilities, the electricity, which is, the growth in electricity is function of the new building, right? The growth in electricity cost is a function of the new building, right?
Yeah, yeah. These numbers are received from Public Works. So Bill Osman gave us these numbers to plug in. So hopefully those numbers will be accurate, and we'll see in the new building that we could, still see some cost savings in some of the fuel and the propane and water. And for service contracts, this year we met with town IT and Chris Kaiser and his crew. We are taking over about 75,000 licensing fees for these certain areas that licensing for Microsoft email accounts, Bitdefender is antivirus, Rubrik is data storage that we use for all kinds of data storage for our body cameras and in-car video cameras and data backups. So all of these need to meet security requirements. So we've inherited these from.
Yeah, so these aren't going up. These are just rebundled with you.
Over from
so
town
Chris's will
IT.
go down.
Right.
Okay.
So those are the increases that we took over from Town Hall IT. Next slide, you can see our internal service contracts. All of these items are requirements for us. The IDEMIA is our fingerprint machine that's run through the state. Those are service contracts with them. Telrecco is our body worn camera and in-car video contracts. Sierra Semtech is our modems for our vehicles to be able to connect for the mobile data terminals. Next Gen is our record management system. So all of those service contracts come up to 176.6, and add that to the 75 from the town is 251.7. So
Just, I mean, modern technology, that's a one department, the software required. And not, you obviously you're like the department as far as cybersecurity and all that, but $250,000 in software.
Yeah.
We are in a new world.
it's yeah. And
If you told Dick Bond that we would spend $250,000 on software, he would.
Yeah. Yeah,
That's
it's
unbelievable.
something that's just going up and up every year. And
John, help me out with the change here. So last year, service contracts were approximately 130,000, and add the 75 in, right? So they get you to what, 205, and this is going to be 250. So where's the $45,000 other?
so
Major kicking
probably the biggest one is Flock. Those are our camera systems, our license plate cameras and downtown camera systems. That was in our capital budget last year, but because it's an annual operating service contract, we move it from capital into our operating budget.
It was how much? I'm sorry. The
That's 7,000 for this year. And I think it was 28 last year, but again, that was in capital. So that's probably our biggest increase.
And that's the software. That's not the equipment.
So it's
Service
all
contract.
cloud-based. So when we log in, it's
But that's the big difference if we're looking year over year. So the big year over year is that, your fixed is about 200,000, but then with the new software attached with the cameras, that's costing us like 45.
correct.
Wow. So a capital expense of 30 beget a $45,000 operating expense going forward. Am I missing something? So this has to do with the cameras, right?
Yes.
So the cameras cost,
The
but we
initial,
keep
so the
replacing
initial
them?
cost was, so we don't own the cameras. We basically lease them from the company. So
Yeah, that's the new model for IT. Yeah.
So the first year, it was all kind of encapsulated into one budget, into the capital request. But now, since we've already established them for over a year, now it's an operating expense because it's just an annual contract.
So with
agreement.
this contract, then are they responsible for trading out cameras that don't work and stuff like that?
Anything goes wrong, they come out and fix them, swap them out. If it's
Okay, so the cost to the town for having body cams is about $50,000.
Traffic.
The roadside cameras,
The
sorry.
license plate
The
readers,
license, okay.
which have been instrumental in helping us solve a lot of these crimes, especially a lot of
Okay.
the motor vehicle thefts and those sorts. But these are all the license plate cameras.
The license
And
plates,
then
okay.
downtown we have,
License plate cameras, it's a $50,000 ongoing expense.
67.
67.
67, yeah.
Oh, yeah, thanks. Okay. Ouch. Okay.
And is Flock the only company? I mean, they're the major player, but they seem like they're always in the news. I mean, we're the data, we're still
Provider. We've compared other companies. Their systems aren't as good. And the other systems are more expensive. A lot of the other companies have an ownership model where you purchase the cameras. And that in the long run gets much more expensive because after 4 or 5 years, these cameras become obsolete. They need to be upgraded. And then you have to go through the whole process again and upkeep. So Flock is the biggest company out there and most widely used. And the information sharing between towns is kind of the sweet sauce of Flock because so many other jurisdictions use the Flock system. We can share information very quickly and very easily.
and the storage of data is for a X amount of time, right? Unless there's an investigation.
Yeah, yeah.
Is that 60 days, 90 days?
30 days, yeah.
We talked about that at length during our ordinance discussion, so it's always stuck with me.
Yeah, no personal information is retained in it. It's just pictures of the license plate. No other information of vehicle owner or any of that is contained in the system. And like I said, if it's not flagged for an investigation or it's deleted after every 30 days.
Got it. Thank you.
I did want to just highlight some areas where we didn't increase or we decreased from our budget from last year. Any other questions on operating? I can move to capital.
That slide though, when you say no increase in reductions in the budget, when you go down there, it's just very tight to where you were before. I guess that's the point you're making here.
Yes. Yeah, we tried to compare not only FY26, but historically what we're spending in these areas and try to keep it as tight as possible.
Yep. Yeah, I mean, you're coming in on a more regular basis for, approvals of everything. It seems like we see you almost every time we meet, so. Thank you for that.
And capital summary, asking for 549. It's largely due to the 3 new vehicles. And then the standard replacement of the bulletproof vests, the mobile radios. The other large outlier is our taser replacements, which we held off from last year. Axon has again changed, like all these companies, they're sunsetting their support for the current models that we carry. They're X26, so they're pushing all of their users to their new model, which is the Taser 10. It's the more advanced unit. And they also have the same model. You could lease them from them for a cost, an annual cost, or you could purchase them outright. We're choosing to purchase them outright rather than going to the 5-year plan, which is about $50,000 a year, which at the end of 5 years would be $250,000. They offer that for some jurisdictions that can't afford the one-time cost, but we feel it's best to just bite the bullet and do the one-time increase of $150,000. That'll replace all of the
outdated tasers and get our line officers the new tasers, the training, the holsters, the cartridges, and all those, everything associated with replacing those.
And reliability, when you buy something like that, there's, technology doesn't change that rapidly in 5 years, I guess
Well, the interesting thing with tasers are they are computer based, so they need software updates. They need to be plugged in and updated. So when the company sunsets the older model, you're kind of left with, we have to update them because they do need to be plugged in and updated and have software updates to be used.
And can you, I can't remember. So on the categories of how we're financing each piece that's tax ported and bonded, the vehicles are in other, what does that mean? Yep. Okay.
So nets out. Yeah.
Okay, great. Thank you. We like that it doesn't impact the.
Yes, so really the capital request was one more.
Yeah.
More like 149 or 249. 149. 249.
And then the patrol rifle replacement, we're just replacing parts and pieces. We're not buying new firearms with those. Those are a good platform that we have. It's just some worn out and outdated, worn out equipment that we're replacing. So that's not a huge increase. Here's the cost breakdown for the vehicles, for 3 new vehicles, the in-car video and the upfitting from specialty warning. Comes out close to 300,000.
Hey, and going forward with the police vehicles, do we pay for them with the extra duty last year? So that'll, on a going forward basis, will offset some of these costs we anticipate. Okay.
And our fleet is doing well. We've shifted over from the Ford Explorers to the Chevy Tahoes, and for the first time in many years, our fleet is very healthy. We were scheduled to ask for 4 vehicles this year, but we don't need 4, so we're asking for 3. So you can see our cycle right now seems to be asking for 3 vehicles every year, and that seems to be working well for us. With the Tahoes, we can get them in a reasonable amount of time. We can get them upfitted, and they seem to be a bit more reliable than the Fords used to be.
good news.
Very good.
It's
Bring to the
of a equipped car. It's $100,000.
Yes.
Yeah.
Yeah, you'd be amazed at the amount of equipment that they have to put into the vehicles now, and all the electronics and what they put in. And it's getting harder and harder with the technology that's coming standard in the vehicles to make sure everything works and all the electronics work as they should.
Yeah.
But specialty warnings been great. They've had a lot of work to do, especially with the newer models, with all of the automation of the new vehicles, the automatic shutoff, the automatic door locks, to get things to continually work that we need to, like the mobile data terminals, and get all of the systems that they're installing to be compatible with the stock vehicles is challenging, but they've done a good job for us, and a lot of stuff is working very well. It's very reliable.
Yeah, I mean, generally a standard car now is so complicated with all the computers on it, and then you're introducing the amount of wiring that they put into these cars for all of the controls that you guys use. It's unbelievable.
A little voltage drop of a few volts shuts down the whole system, and it reboots, and it's quite an undertaking. So it's a significant expense, but you can see why once you look at all that they're installing.
In our average life, we keep them for how many years? I should know this.
We keep them in the front line close to about 80 to 85,000. But then once,
which is that 3 years, 4 years?
Usually 3 to 4 years. But then, and then once they're no longer serviceable for frontline patrol use, we'll phase them out into there'll be an SRO's vehicle or in an administrative role for training or something like that. And then we get a few more years out of them in those roles. And then if they're no longer in service for that, we'll cycle them to another town agency or we'll trade them in.
Yeah, it's amazing. There's some old ones still rolling around. You see,
It took like 8 years,
yeah,
right?
well, even longer than that. I mean, I keep seeing a Tahoe in town that has the logo on it, and it must be like, I bet you it's at least.
Yeah, I think Chris Kaiser is using that one.
Oh
That's
my
one of
gosh,
our old
it's amazing.
police vehicles that's still rolling.
Yeah.
I think we finally got rid of the last Crown Vic.
Yeah,
So
that's gone.
that's
But planning and zoning may have one. I think.
Yeah, well, we definitely get our money's out of them. They roll. They're like second and third lives that they go through.
Yep.
I was gonna ask about the AEDs. All the cars that we have all have AEDs on there.
Yep. So all of our
got
first
something-
responders, they all respond with an AED unit.
Yep.
We don't leave them in the cars. We take them in and out if the car's not being, because they are the batteries are temperature sensitive. So that's part of the officer's daily shift is to bring the AEDs in and make sure they're in service and check them and test them and make sure they're up and running, because when we need them, can't
Gotta
have them fail. But
Yeah, the cold can really crush the battery.
Did you have extra units that you had to install this year? Because I'm looking at your projections for, and then last year's and this year's, there's just bump up in the number.
yeah, again, the costs increase with those a little bit.
Well, that doesn't, your 5-year capital plan doesn't reflect that. So that's why I'm,
Yeah, I'll have to dial in the numbers, but I think we're adding every couple of years, we have to replace some of the units. They're no longer serviceable. So
Yeah, there's some that are end of life this year. They're about $2,800 each.
so I just, the question is, last year it was 75, this year it's 12,000, and then your 5-year goes back to 7,500. So I just want
Yeah.
to understand why you have this 1-year bump. Is there extra?
I just don't think I projected out into the 5-year
Okay.
future
Okay.
costs. So I should probably tighten up those
Yeah.
5-year projections. But
that would be great.
yeah,
What's their useful life?
about 5 years, about 5 years, and then if we can replace the batteries in them, we do. But sometimes they just need to be cycled out. You know, they just kind of wear out from being in service that long.
They're not used often, right? You just have them. They're like an
Mm.
emergency stuff.
Probably more than you think, you know, because we are the first responders, so we do,
You get there before the ambulance.
you know, our officers will place the pads on the patient, and then EMS will come in and they can attach their AED units. So the paramedic, they're compatible with the paramedics unit, so they can just plug right in. So they're used more than you can think, and there's probably more than a few people that are still walking around town today because of those units. So they might come in here and support the $12,000 cost. So they do save lives. And then the final slide just again shows that the body cameras and the in-car video cameras are required by state law. We are maintaining those throughout our entire fleet.
Just because this isn't for this year, but I can't help myself looking at the 5-year capital plan. And there's a new line coming in next year for drone first responder for 75
Yeah.
grand.
So we wanted to put that out there. It is something that is trending throughout other agencies, and that's a first responder drone. And it's not, it wouldn't just be for police use, it would be all first responders. So police, fire, EMS. What they can do is respond to a scene. If let's say we have a fire call, it could get dispatched and it could fly to the scene, and it could give an aerial view of the situation, whether it's a fire or if it's a motor vehicle crash. So we are seeing other agencies. We'd like to put that on the
So
radar.
we already have a drone. So how many drones do we have right now?
We have 2 right now. One that has to be deployed by a pilot. That's a bigger one that can be used outside during scenes.
Mhm.
Then we have another smaller one that's an internal drone that can be flown indoors. That is better for tactical situations. It was actually used recently. Our small drone was used in Stanford during their standoff that they had about a month or so ago. The individual was shooting at the police officers and actually shot down and disabled 2 of Stanford's drones. And our drone was able to go in and determine that the scene was safe. So it's very useful. So we have 2 drones that are flown by drone pilots. This drone as a first responder is something that's more automated. So when a call comes in, it can be dispatched and it can fly directly to the coordinates of the call and give real-time information to the responding units, again, whether it's police, fire, or EMS. So it's something that we would like to consider and work with our partner agencies at fire and EMS to see if it would be beneficial. But it is something that we wanted to just put out there in our 5-year plan to see if it's something that would be useful to the town. We are seeing some other agencies go to the Stanford and some of the bigger towns, cities that have them, and they find them very useful. So it's something that we are exploring.
This seems like a big number for a drone, but I'm sure it's just a placeholder.
It's a big commitment. As I said, it's automated. It's something that it lives either on the top of the police building or fire or some centrally located location, and it's all automated. So it flies into a little garage. It swaps out the batteries automatically, and it's connected to our CAD software. So when dispatch comes in, they can push a button and it can start taking off and flying to the scene.
And would this generate a service contract? I bet it would.
Probably would.
Yes, it would.
Yes. Yeah. It's
An
definitely
IT budget. Yeah. So
it's definitely an emerging technology that we wanted to be aware of and be at least considering.
and the new stuff's always expensive. Comes down.
Okay,
All right. That's it.
all right. Any questions?
No, I mean, I'm reading through the body camera and in-car bill here, and I didn't realize that the dashboard cameras would be required as well. So
Yeah.
so you guys have dashboard cameras and body cameras.
Maybe they can negotiate with the legislature can negotiate with the technology companies to
Be nice.
mitigate the
Instead of giving
increases
us
in
unfunded
technology
mandates,
costs.
they could do that. That would be
I always
nice.
love those unfunded mandates. Great. Let's keep doing them. Okay. All right. Everybody all right?
Yeah.
All right. Thank you very much.
Thank you guys for all you do for the town, keeping us safe, and thank the officers for us as well.
Think about
Great fire.
Morning, all.
Morning.
Official.
So our Department of Fire Services budget for FY '27. Couple things we accomplished in '26. 3 new volunteers came into the company. Multiple members finished Fire Instructor 1. Multiple members finished mobile water supply training. We had 4 people go to structural collapse technician Swift Water, so enhancing our rescue capabilities. And then we're providing that through the entire department. So that met some of our FY26 goals and objectives. Our public education continues. Just under 50 events, 37 public service events, hanging the flag or, a ride to school for a fundraiser and those type of events that we consider public service. We continue our smoke detector program for people who request smoke detectors, or if we're on an incident and they do not have an operating one, we're still providing a smoke detector from our donations. And that includes carbon monoxide detectors and batteries. So some of our numbers of what we've handed out to our residential community. We did launch Community Connect last year. 300, as of doing this presentation, creating it, 360 residents subscribe to that. We're starting to see it. Not a lot of calls, but some calls that we see the information that the community provided on there, which is helping our responders for entry into the property, or just knowing how many people are in the house and some other utilities and so on when we go for an incident. And then the volunteers prior to that came on board FY25, they completed Fire One. So 6 more members completed Fire One, bringing them to active status within the department. So full-fledged firefighters. And then we ran our in-house Firefighter 2 class to bring members up to the next level of firefighting, which helps us in grants that we apply for and so on. That brings that we have we met the NFPA 1001 standard for firefighting to a almost, it's 100% that we're meeting the standard. We're about 90% members that are trained up to Firefighter 2. What we did last year, ended with 1,239 calls for service. 55% of them are still fire alarms. That's automatic alarms coming in from alarm companies. So that's the bulk of our responses. Doesn't mean that there wasn't something happening once we got there, but that's how the call was transmitted. Our mutual aid was 25 times we went out of town for different mutual aid responses, and we had 25 incidents that we brought in mutual aid within the town. And within that, our calendar, this is calendar year, we had 95 times that we had simultaneous incidents, that we had multiple calls going on at the same time.
So the whole alarm, I mean, I know you guys have to respond, right? So is it just faulty alarms? Have people tripped them? Is that mostly?
Cooking is probably our highest numbers.
So you get like smoke or something.
Yep.
Yeah. Okay.
So they're not false alarms. Something actually tripped the alarm.
Okay.
Even a contractor doing sanding of sheetrock that doesn't cover the detector, it simulates it as smoke. So that would be the alarm's doing what it's supposed to do. So you can't really fault the homeowner that the alarm did what it was supposed to. We're trying to do it, and you'll see that with the objectives coming up. We're trying to do training for contractors, creating videos so they understand. So that would reduce that a little bit, but the alarm is actually doing what it's supposed to. We do get some malfunctions though. There is a percentage of malfunctions. It's around the 30% of those alarms are probably malfunctions. People need to service their alarm system.
Is it when you go out on a call with alarm, what goes out? I mean, how many vehicles?
If it comes in direct as a fire alarm, we dispatch 2 pieces of apparatus, and the volunteers are called in. Okay. So any call that goes out, the volunteers would come in for a fire alarm. There's times that the homeowners will call first, so it gets downgraded. Quite often it gets downgraded, and then we respond non-emergency. So then just to verify the alarm, or they're telling.
Oh, you still go out, you just slow down.
Yeah.
Okay.
basically. Once we get information from the homeowner, there's nothing happening, we downgrade it and just go for the investigation because they're confident that they don't see anything happening in their house. And then we'll go and verify that because there are some places where the homeowner might not notice that the alarm has transmitted from, and they still can have an issue. Our property loss for last year, calendar year, was just under 400,000. 394,000 was our property and contents loss for the fires that we did have.
Chief, where does that number come from, that 394?
I'm sorry?
That 394, that comes from insurance or?
That is our fire marshal has created a schedule based on, what the cost is to rebuild, redo a kitchen, redo a bedroom, and so on. So fire marshals don't like to put the true value, like they let the insurance company handle that. So we're just using the schedule to meet our standard in the reporting system. So that's kind of how we set that number up.
Do you know how that compares to the prior year?
I would have to go back and look, but I believe we are down from the previous year. We had a significant, I think we were at 600,000 in the year before. We had a significant loss on Oak Street.
Okay, I was trying to remember if Oak Street.
We were lower than that. We had more calls this year.
Yep.
But we're down from the prior year before.
Yep.
And I always like to look at the incident. We had 40, I think it's based on it was 44 coded fires. That was 37 million worth of property that did not get, that was not a loss. So in those calls that we actually did something, stop some type of loss. So that's the building value under the taxes. So that's the value of property that was protected.
What does coded fire mean?
Coded fire is the national reporting, the incident reporting system. If there was actual flame, if there's any type of damage, that gets coded as a fire. So a cooking fire that gets beyond the pot would be coded as a fire. If there was flames in a actual electrical outlet, would get coded as a fire. So I might not have had any property damage, but because the outlet caught on fire, then it would be coded as a structure fire.
Right. So you wouldn't necessarily have to use water. You might do a blanket or something to put some of this stuff out.
A lot of it we won't. I mean, there's nothing that there's no action taken. It's just an investigation. But how the national standard wants it is anything that has flame or there's a fire, then it would get coded as a fire in that case. So that's where the 44 coded fires come from, and that's the national. What we look at, the 12 actual true fires that we had throughout the year, those were that we did something as far as structure, firefighter response, extinguish something, maybe pulled hose, use an extinguisher to put it out. We had 12 of those and 10 accounted for the loss. So some were still non-loss. So those 10 fires counted for the 400,000. The 394.
That's a pretty low loss. I mean,
prevention is the way to go,
right? Yeah. I mean,
Yes.
It's for something you actually physically, get involved.
No, it's a combination of obviously suppression response, and it's the fire marshal's office, putting out what we do for prevention, building codes. Everything goes into this that it helps with that reducing the loss. Our goals for 27, continue to increase fire prevention, public education. We are, like I said, expanding it to our business community, trying to help contractors, limit the alarms, do things that, know how to handle certain incidents that happen in restaurants. And so those type of events that we're trying to come up with short videos to kind of help them with the business. We also want to expand community connect to our business community also. So we continue to get key holder information and key things about their business, whether they got hood systems and so on into the system, and kind of helps them remember to check it also. So that's kind of that prevention side versus the marshal's office goes in every year and just reminds them. So we want another avenue for them to remember, okay, I need to do this and make and schedule a maintenance. So our fire marshal's not going in there and say, you didn't schedule your maintenance this year. So if we can do things proactively to help them get the job done, and which is also helping us with prevention. Continue to enhance firefighter health and safety. Still a huge initiative with cancer reduction in the service. So we can, continue to do that with it, whether it's current gear washing or stuff that we're purchasing, PPE that we're purchasing is compliant with the Connecticut standards and national standards moving forward as far as cancer reduction, the materials that are used in there, or how the materials work to protect the firefighters. We also started cleaning our inside of the apparatus, doing basically upholstery cleaning within the apparatus. As we get in and out with the fire gear or the turnout gear on, it contaminates it, and we make sure that that's staying clean on an annual basis right now. Standardized water program. So we're looking at our current fill sites. We're kind of modeling after City of Stamford, how they're identifying specific sites. We have a lot more than them, so it's a little harder, but we're building out a template that we can tell our mutual aid partners that where fill sites are, where they would be able to start providing a water supply. And if you look on the right there, that map is one of our members measured out 1,500 feet for each water supply. So that's 1,500 feet's important because that's what our engines carry for hose. So we know where we're within a hose bed of all water supplies. So that was level 1, I will call it, and putting that on there. So as we're responding to the calls, this would come up on our iPad and they can look at that and say, okay, I'm within 1,500 feet. We know we can make that lay, as we call it, laying the hose line to the water supply to supply that house. Otherwise, we know we have to go to like a tanker shuttle or something of that nature. And it's easier to see if it's already pre-populated on the map versus trying to measure it. So that's something that we're enhancing our records management system so we can do that and see those easier. We're in the process. AC is working with one of our lieutenants to quantify our driver operator program. So we're using task books.
Didn't know assistant chief is AC. So.
Assistant chief. So they quantify the driver operator. So we're getting true. It's not just based on time and miles, as history we used to do a lot of. Now we're looking at specific tasks that each driver would have to do, whether you're a pump operator, whether you're driving different apparatus, positioning, parking, going down certain streets, backing up. So we're putting that in task book. So each driver would have to quantify that. And then also, one, it's great that we're going to limit any mishaps with the apparatus, but that's when we're looking at who governs us. ISO looks at driver training so that all those hours count. Unfortunately, they use hours. That'll count toward meeting their requirements for our accreditation. And we're starting the same with the officer development and things that each officer needs to do at the officer level. And these are all governed by NFPA, National Fire Protection Standards also, but a certain level driver needs to do and each officer needs to do.
Chief, over the years, we talked about that, back to that 1,500 feet from water sources and all the dry hydrants we've sort of developed over the years. What's the ruling on pools? I mean, if somebody has a swimming pool, is a homeowner obligated to let you use their pool, or is that sort of a private property permission kind of thing?
It's kind of private property permission. I guess in exigent circumstances, if we use the pool, we could. Usually we can't get to them. So we have a couple pools in our water supply program. Yeah. We actually used one back in November up off of Onoke.
Is that, is there a way to survey residents to see if they would say, it's like an organ donor, would you use your pool for X?
Fire Marshal Payne and I have been talking about that and to see it maybe not so much the current. We can still look at the current pools, but as we look at pools moving forward,
Because there's a lot of pools. I mean,
Yeah.
there's a lot of water.
Yes, and the nice thing about pools that plan for it is they put the piping in so we have access. Like there, I believe Turtleback just did one. I don't know if West or just Turtleback, but it's they pipe it out to a location that we have access to it.
Okay.
So that's the nice thing.
Fencing around everything, it's
Yeah, that's
hard.
true.
With the pool, right? With the actual pool, and they're usually in the backyard. It's very difficult for us to reach them with our hoses and so on. But when they pipe them out to us like that property did, they do it for their insurance, but it's nice when they do give us that permission that, yeah, you can use it for other properties, which we did up off of Oak in November, and we drafted off their pool.
Okay.
So it's doable, looking at it more, most of them are, 365 available. So they are available to us, but we do talk to the homeowners prior to that.
Yeah, I mean, I think most homeowners would agree that if they needed help, they would take it, and if they would give it, they'd give it. I mean, our thought, and we did ask that home, hey, do you want your 1,500 gallons back? And they were okay with not. But if the next call the next morning would be to the pool company, pool water company to help them fill up. Yep. So they have, when they do it, when they build it, when the pool goes in, there's a lot of mechanisms in place that's not going to allow their pool to fail, which is good. Or as we're draining it, cause some type of siphon for anything to go into the drain. Yep.
So,
thank you.
Yep. So that's where we are. That's where we came from. That's where we are for 27. What we're looking for. Our request for operating is $4,852,000. Overall increase of 1.3%, which is actually only $62,980 for the increase. And I broke out staffing costs here because that's one of our major drivers. Are we current? Because we had a couple different changes on that with the increase and I heard PD talk about there's a built-in for the contract negotiations and so on. So just making sure that we're on the same.
Question.
Yep.
Ann, well, this is for Ann. Was 2% in this one too? Because I mean, okay.
Well, how
did
does
we
go up
have
0.5%
some?
then?
Was it? We're only showing a 0.5. So
is there some staffing change?
Staffing change.
Negative.
Okay. All right.
Let's make sure we got the number in there right.
Yeah. All right. Yeah. So that's we're pretty consistent on our overtime's gone up in the about 2.5% with increased step raises. So the firefighters we have 6 firefighters still in steps that are coming up. So that increases on their overtime pay for vacations and when they're covering holidays or any other time off. So that was the increase across the board for our usual time off requests. So again, we're staffed at 6. Anytime somebody takes off, we have to fill that position. We don't have anyone that fills it with extra people on shift. So person takes off, then we have to fill it. Our sick time stays steady. We're still at our usual average. So we're just below, as our numbers were about 4 24-hour shifts per person is the average sick time. So we held that at the 180. Our callback going based on the raises and our average over the last 3 years, bringing it up to 15,000. So an increase of, I think we're at 10,000 in 26, right? Or 11,026, right there, revised. Excuse me, bringing that up to 4,000. So that's those structure fires. When any type of structure fire or mutual aid assignment comes in, the career staff is eligible to come back for coverage and or to respond to the fire. So that's our how we're meeting our staffing needs for structure fires within town. So, and that's been average of we've been over budget on that for the last few years. Since unfortunately we keep talking about COVID, but since COVID, it's gone back to the normal mutual aid responses and callback responses. And then we reduced our injury line just based on the last few years. This year, 2026 is already, we had a person out with an injury, which has already increased, but for the most part, we've been pretty good with no injuries that were significant.
No, I was going to say.
Yeah, unfortunately, this summer we had one that went into FY26. So that was already used that budget. So that's our major salary lines. I don't know if you have any questions on those.
So just be sure. So on overtime injury, that would be injury that's incurred on the job versus someone got injured on their own. It would be sick leave.
That is correct. Yep. So we did have a sick leave injury also. So that kind of skewed some of the numbers for 25. Somebody was out with an injury, so he was on sick time, going through that with his therapy and everything. So since back, so that was off the sick time line. Our major increase also this year is a increase to 145,000 for our maintenance, our mobile maintenance repair line. What we, going through the services to service our 7, I didn't include the staff vehicles in here. They're reasonably minimal because highway takes care of those. But our annual service work is $51,000 to maintain the heavy equipment, the engines, ladders, and the rescue truck and our tanker. So that's our annual. We know we're going to spend that. Engine 7, which is our frontline pumper right now, is still waiting for some motor work. That's non-priority. Our engine dealer Cummins says it's non-priority, but we need to definitely get that done. It's costing us a little more in annual service than normally would, waiting on that repair. Our usual tires for the fleet, probably a little high for next year. Just got the purchased tires this year, and they actually went down a little bit, which was nice. But 14,000 for the number of tires we need to replace. And what the variable is the average 3-year repair cost is roughly, around 50,000 on unscheduled repairs, stuff that we don't know is going to happen, like a radiator or an alternator, ladder, something on the hydraulics of the ladder. Those are the big cost items that we've incurred over the last few years, and kind of preparing for a little better moving forward.
So last year you had 114 for this line item, and you
for 2026 we had adopted was 115 for the for the adopted. Also, I was again looking at our what we had planned for the year. I didn't include the emergency repairs, so I was looking at 115 going into the meetings with the first selectman. But looking back and saying we needed to count for averages because it's just the fleet is getting older and we're having major repairs come up that are undiagnosed until they, unpredicted.
Okay.
Yeah, we're getting a couple, 1 to 2 of those a year that we're that are happening with the age of the fleet.
So how many big trucks, the engines and the tankers and the pumpers and stuff like that, total that type of fleet, not your cars and response vehicles?
Seven pieces of
so
apparatus, seven heavy pieces of apparatus.
And what's the, I mean, I don't know if it's easier just to go by each piece, the age of each piece, or the average, like, where are we on the age of each piece of equipment?
Our newest piece is currently 2021, which is the rescue truck. Our second youngest piece is engine 7, our frontline pumper. That's 2017. Our backup engine to that is 2013, which is a mirror image of the first two piece.
That's engine 4.
That's engine 1. That's engine 1.
2013. Okay.
The tanker 8 is 2008.
That's 20 years.
The ladder truck is 2003. Engine 4 is a 1999 pumper, which kind of mirrors engine 1 and 7. And engine 2 is a 1997 pumper.
So what's like how long are these supposed to last?
25 years, 20 to 25 years has been the industry standard. I think we do very well. Our members do a great job doing the inspections on them. And the maintenance that we do get from our vendors, they are probably pushing closer to 25 years that we can run them for the amount of mileage that they get in hours. So 25 years would probably be the target on the apparatus.
If you told me that, you have 7 vehicles that are that old, so your newest we just said is 21.
Right.
So that means that, we're in 2026. So
yeah,
it's
the average age is 17 years.
Thank you, sir.
17
years.
17-year-old. So we're maintaining 7.
Conservative than the chief, I think 2022. Yeah. And you got to order the truck.
Yeah, well, that's been the challenge is
I mean,
is
we have
ordering and
3 trucks here that are in that
older.
in that older category.
So there's 2, and there's 2 sides of this. Obviously, one is the equipment cost is coming quickly, and we need to prepare for that. But the other side of it is, I just $145,000 divided by 7 is $20,000 a year to get all these things maintained and running so that they can respond to emergencies. To me, I look at 145,000 and I say, is that enough? I mean, it sounds like a lot of money, but these are specialty trucks that require a lot of, I don't know. And they're old.
Well, you're literally like telling me to go to the capital budget lines right now.
Exactly
That's
where I was
where,
going,
I mean,
so.
that is what I'm.
got some numbers in capital to,
Okay.
But the capital numbers aren't jiving with Sven's 22 years. They're maybe jiving with 27, 25 years. Because it takes a while to get them. I mean, we have a 2003, a 99, and a 97, right?
well, we have an engine coming in the end of the year. So we already purchased in 24. We had money that
So
was
you have
approved.
2 more that.
So one of those engine 1 or 2, engine 4 or 2 are getting replaced at the end of this calendar year.
Okay. All right.
So
then we have
that
2.
one's on order.
And then I know you
I would
have
hope it'd be
something in this
2,
budget.
unless for some reason 2 is like significantly better than 4.
Your timeline for a purchase running between 900 and 1,000 days.
Yeah, right. 3 years.
Wow.
Yeah. It's kind of like it's
Yeah,
like
it's 3 years, 3 to 4 years.
That's what we're running with the ambulances.
Yeah.
And you don't want stuff like this to be down. I mean, you can't have it down. So,
That industry is very consolidated. It's didn't PE buy it up?
Consolidation of the industry. And,
Not to people's advantage. Yeah.
it's scary.
Yeah.
And it's hard to think about the word collusion. Anyway.
And there's a lot, the standards that keep coming out. I mean, there's a lot of working parts that drove some of this stuff, but.
Okay.
Okay.
You know what? You should
Sven.
come up
You
if
should
you're
come
gonna
up,
Sven.
say,
Sven.
shouldn't,
Ben, you
shouldn't,
should come up so people can hear you.
Thanks. Yeah, with the, when we talk board of finance and we talk capital budget, with the extended period to go from signing the contract and putting 50% down to receiving the truck and paying the last 50%, if it's 900 to 1,000 days, we need to think about accelerating the purchase within the capital budget. When we
Realizing we'll pay half up
where
front.
are we going forward?
Yeah.
What are our needs? And you just saw that we have, like 2 trucks that are, hanging. We've got one coming in this year. Okay. But we need to plan forward. If we, my big concern, as a fire commissioner, is that we have to absolutely rebuild that ladder. We have to refurb it. And when a truck comes in, I will tell you and the Board of Finance and the Town Council that you will have 10 years out of that truck. And in that time, you're going to have to build a new firehouse. So you're going to have to find the land, go through the NIMBY, build it in order to get another ladder in this town. So we got to baby that ladder along.
Yeah, ladders, there's no ladder on the market that would fit weight and height requirements of the current station. That's our, so.
You see the ladder bay, we've already cut the lintel.
Right, yeah, we had to alter it. We altered that one bay to get it in there the last time.
1934 firehouse. We're not going to get another ladder to fit.
Okay.
Sobering.
Yeah, absolutely sobering, Amy. It's just, but these are the facts, and this is, what we have to deal with as a town, and as a fire service. We have to protect the people in this town. We have to have a ladder truck. We have to have a tanker because of, the way this town is, supplied with water.
so is the million that I see in 28, 29 for a ladder, it says refurbished.
That's for refurbishment.
So what's a new truck cost?
Oh.
So that ladder, that 23 ladder that I see in the equipment list, that's a refurbish of that 23 ladder?
03, yes,
03, okay.
correct.
Sorry.
Yep, the 2003 ladder, that would be for refurbishment, as Commissioner mentioned, that there is no ladder truck on the market right now that fits in the firehouse.
So that $1 million in refurb costs, what would that, how many years does that give us on a ladder truck?
10 to 15 if we, it's again, call volume, but it's a 10, refurb, you're looking at 10 more years on a piece of apparatus.
What do you do? How long does it take to get refurbished? And what do you do when you don't have a ladder truck in your fleet while it's getting refurbished?
First, mutual aid is, phenomenal here. So we actually get a out of town ladder truck on an initial structure fire, if ours is in service or not, because ours is not staffed. Right now, it's a callback piece. So whichever, when it gets out, if it beats the mutual aid there, so we're getting mutual aid for the ladder truck. The second question, how much time? Didn't really ask that with the vendors, the one vendor that's starting to put together what needs to happen on it. I'm gonna estimate 6 months on the refurb. What do you think, Sven? I don't know, maybe a little more. Yeah. If the one vendor the one that's looking at it, that built the ladder truck originally is in Wisconsin. There's other ones local. The Watertown's another one. I don't know if they'll do a ladder truck refurb, but that's we didn't go that far to select the vendor yet. Right now, we're just looking at the manufacturer to get what needs to happen on it, since it's their piece of apparatus.
We should go back to the OEM.
So, and then the $1 million that you have in this
Original
year
equipment
for
manufacturer.
refurb, that's for either the engine 2 or 4?
That'd be the tanker.
Tanker 8.
Tanker 8 as
because you're getting a new truck coming in soon for 2 or 4, and then so this would be for tanker 8.
Okay.
So what is a new engine or tanker cost approximately?
Two most recent tankers that were purchased in the area came in at about 1.4 million.
So we're putting in $1 million to refurb, but a brand new is 1.4?
This is a ladder truck.
The
No,
ladder would be. the
Hang on,
most
no, she's correct. She's correct. I have a,
two refurbs
I-
for two tanker. I got an engine and a tanker
I'll
for
be,
$1 million.
I don't have the number yet from Seagrave. I'm still waiting on their hard number of what they said needs to happen. So I was leaving the million as a placeholder. I have no other answer for you
Okay,
because I don't have the complete answer yet.
okay, because I mean,
I know.
that conversation needs to happen before we put $1 million into refurbing. If it's $1.4 million for a brand new vehicle.
Except doesn't fit the ladder.
Well, the ladder,
the ladder.
but I'm talking about.
Yeah, the cost of the next ladder is the cost of building a new firehouse.
Okay,
And the original,
okay,
the million for the tanker was a placeholder until we discuss it in the commission meeting.
Yeah.
That I think we need to move it up. Otherwise we're gonna spend probably 75 to 100,000 to do some needed repairs to it. So if we just move the refurb up, the problem is I didn't get from Seagrave, the manufacturer, I did not get that hard number yet.
but I guess my question is, that's that tank, is it tanker 8 you're talking about?
Yes, correct.
So that's a 2008 vintage. So at that point, in another year, it's gonna be almost 20 years old.
Mhm.
Correct.
So for $1 million, I think we need to talk about, does it make more sense to spend $1.4 million on a brand new truck?
And-
If it's $1.4 million, if it's $1.4 million, and
I'm
versus $1 million on a refurb.
I don't disagree with you. The other reason why I would speed up a new purchase is right now with the current federal administration, emission standards kind of are on hold, which allows for the sizes of the vehicles that we currently have, that they're still coming in at that size. That was another concern why we were looking at refurb so quickly, is because if
I'd have to
the
get
emission
rid of-
standard increases the size of the cabs, it might not fit in the firehouse.
Okay.
So right now, in the next couple of years, might be a good time to contract for a new piece of apparatus, because we can still get the same size motors and cabs that are currently being produced. That was my fear moving, if the administration didn't retract some of the emission standards, that's where the industry was going, with bigger motors.
Can you move your slides forward?
Oh, so, I mean,
Sounds like we need some more information.
Yeah.
yeah, and unfortunately, I mean, Seagrave they could come back with, refurb's gonna be $500,000. I don't know.
Oh,
Until
okay.
we know all the stuff that
Yeah.
they looked
Yeah,
at.
because that
and-
sounds crazy, that small differential on a refurb versus a
It
new
could
truck.
it could come in lower though, and that is a possibility. It
Okay.
depends once they.
How
look
soon
at
do
the
you think you
framework.
can get estimates on the,
I'm hoping by Board of Finance,
okay,
every week I'm asking where they are with their,
They came in June. I mean,
yeah.
It's been a while.
Yeah.
It's been a long time. So It's been a
Okay.
process.
and they don't want to give me a ballpark. They're going item by item down and see hey, this is what you need, and going from there. That's where we are with the process.
okay.
We're going from the big to the tiny, okay?
Want me to go back to,
No, you're good. I'm just going to do capital. Classroom tables are $8,000. Okay, what the heck?
12 tables, they,
I think this
they're
was
like,
my
they're
first
700, yeah,
send
they're,
back as
the
first
ones that we're
selectman
looking,
with
yes, the ones that we
somebody
were
with
looking at are
tables.
about 700 and change a piece. They fold up, they roll, so they have they could fit 2 to 3 people at each one. We're getting a lot more classes upstairs. Other agencies are using our classroom. So these tables are a little softer to write on. They have privacy screening for the person sitting at the table. And more important for us, they're going to fold up and store better, because that's a multi-purpose room we're using them in. So that's where our volunteer bunks are. If we have extra people on duty, the volunteers come in, they get pulled down, so the tables have to get moved. That is for 12. That's for 12 tables, assuming we have a 24 to 30 person class.
I mean, we're all looking at each other. We've all been to Costco. We've got the fold up tables. Those don't fold though. I mean, they fold up, they have little wheels, they go into the little closet. I have them at my church.
I went to the furniture manufacturer that does, and again, we're looking at
That's why.
the fold up tables that roll that we can stow,
Can you like sharpen your pencil on that one? That is a very.
Forgive me, everybody.
Right.
I'm gonna jump in if I could.
It's nits add up.
I still want the privacy screening for the people that are sitting there. It's respectful.
Those little, haven't you ever heard of those little like trifold boards?
These are the ones under here. So when you're out in front, it's just more respectful.
You're gonna have to show us a picture that justifies that. Picture paints 1,000 words.
Yeah.
Hey, everybody, this is Ryan. I don't want to jump in, but I think we'd already taken that 8,000 out and put it into operating. So this is not, from my notes anyway, that 8,000 is not in capital request anymore.
It's still there, Ryan.
It shouldn't be on mine unless I didn't update that appropriately.
Okay. All right.
Yeah. So again, that's 12. I mean, I could go at less, and in the back still set other ones up, but those plastic tables, when people are taking notes, that's difficult to write on with a pen sometimes. So, but
you having a hard time over there writing with pens?
They're writing on pads, so that's.
We've appropriately abused you for that one.
Anything else on operating? Because that was all my operating. There was no other. Building management had a big increase in our one of our utilities, but I think it was just us switching the gas. So the price difference in the use of gas, that was like one of the other big increases in the operating budget. I don't, nothing else.
Gotta go right slide.
Yeah, can you get to the right slide?
No, I don't have a slide for it. That was the only other major increase in operating that I didn't put a slide for it.
Okay.
But I don't know if there's any other questions on operating.
Yep. No.
Then we go to capital.
Yeah. So capital.
Yeah, and the capital, as we started on a reduction in PPE, we've been fortunate getting reimbursement from the state for responding to the Merritt Parkway. So that's been buying the fire company gear. So I've been capitalizing on that. Radios, continuing radio replacement. These would be for mobile radios in our primary response apparatus that go out of town. So they can easily switch channels as they go to different towns depending on what frequency they're putting us on. So we went with portables. They need the portables for actually operating. Originally, we were trying to change the channel on the portable so they can listen. Very difficult for them to seat belt it when they're getting reassigned a channel when they're going. So that's for.
So these are outside, Chief, of what Russ Kimes presented our full look at radios. So these are outside of.
Well, this would be, if he had his capital number, this would start to slowly come off the capital number. As I start to switch, like the new apparatus is going to have a radio. That's one of the radios. If we switch the tanker, we switch the two primary engines. As we switch those, and that comes off his capital side.
Okay.
So,
and these radios will be eligible if we decided to switch to the state system.
Correct.
It'll take that.
Yeah, we're buying compliant. We've been buying compliant radios for a few years now that they're going to go on the system.
Okay.
It's the radio abyss. Yeah. There's so many different kinds.
Yeah, separate.
No, it's a monopoly.
Yeah, this is.
I like fire trucks.
Yeah.
Actually, Chief's Senator Blumenthal is in West Hartford today to have a press conference on the fire truck monopoly, and I don't want to call it the monopoly. It's the cost of the apparatus and the time frame. So that's actually going to happen at 11 today. Tools and equipment is our catch-all for a lot of long, duration things that we're going to keep a while. We do need thermal imaging cameras this year, which is about a 10-year service life. And then we need to replace two AEDs throughout throughout the next couple of years. So that's one of them's in here, ours are, no longer supported. So ours get a little longer use just because they're more climate controlled, than what Chief Federico talked about.
I was gonna say, these are a lot more. How many are in there? You only have one.
AEDs, one AED, we have one AED I'm planning for. We have one thermal imaging camera, and then our normal replacement batteries, tools, and equipment for our other battery operated tools, and gas engine type things are all included into this one account.
So do we have a thermal imaging camera now? And
we have various ones, but ours are over 10. A couple of them are over 10 years old. So that's what we're trying to start to replace those. They look at about a 10-year service life on those. Training props is to replace the our forcible entry door, which is over 20 years old. That was the original one that was manufactured. The one we're looking at now is more meets our town a little better. The doors that we're up against, and the more things that this one can do. So really just replacing an old prop with a better one that meets what we're responding to. And there's also a your flow meters in there, right? For again, part of our pump objectives.
Yeah.
If you wanna.
So when I got here, we started going over all the aspects of our operation. And one of the critical things, obviously, is making sure our hoses flow as much water as we think they do. So there's a pressure that we're supposed to set them at that's supposed to achieve a certain amount of flow. These flow meters that we'll have in there allow for me to test. So I've been borrowing them from some of my friends in other departments, but this will allow us to annually check to make sure we don't have any issues with our pump, make sure our hose is still functioning to spec, and make sure that our nozzles are still functioning to spec.
And that ties in with the task books that we're doing for driver operators. So we can see that they're meeting that objective of getting that amount of water out of the apparatus. So we say, okay, you're a qualified driver now.
It's what we do, water flow.
Yeah, kind of important.
Yeah.
Okay.
Where is that on that list?
What's that?
That's under training.
Trading props.
Within
That's
training.
that put under trading props for the flow meters and the forcible entry door.
The door is now 20,000. It's a flow meter and the doors.
And flow meter and the doors. Yes.
Thank you.
We're starting our rescue tool replacement over the next 3 years. So this year's ask would be 75,000. We're going to replace one apparatus at a time with battery operated extrication tools. Right now we have hydraulics. So those, just very cumbersome, and they're not as strong because they're 2009 and 2012. The strength of the cut and the spread is not meeting what we have for vehicles that we're seeing with the newer vehicles nowadays. There's a lot more different alloys that the cars are made of. So we need the stronger tools to do that. And we want to go to battery, which limits the amount of equipment we have to carry to the vehicle when we're doing the extrication.
So I'm sorry, can you just clarify the AED and the thermal imaging camera is in what line item?
That's in the tool equipment and tools. So
okay,
kind of small.
Yeah.
And
Yeah.
I get smaller purchases, but long term.
And so,
What's that?
One screen forward.
You want me to go one screen forward? Oh, okay. Thank you.
Yeah.
So sorry about that.
and so this is the extricating equipment.
Yeah, extrication. Yep.
And so $75,000 buys how many pieces of these are battery powered extrication?
Right. So 75,000 is going to buy our initial set of a cutter, a spreader, and the hydraulic ram, which is the basic set for and the accessories that go with that for one vehicle to get one of our apparatus up to good to go. And then you'll see in the 5-year plan, it's we did it over 3 years. Going to put in for a grant. We're going to try an assistance to firefighters grant again to get the entire component to match what we currently have. We're actually reducing one apparatus. We're not going to have it on 4 pieces of apparatus. We're only going to carry it on the 2 frontline engines and the rescue truck. Instead
Okay,
of
when
having
you use the word apparatus, you mean the trucks.
trucks, yes, that's the engines and the rescue. So yeah, we're downgrading one set of tools because they are battery. It's a lot easier to move them from in-service piece to an out-of-service piece from the in-service piece, versus now our hydraulics are built into the apparatus that we can't move it as easy when we have a apparatus out of service. So we are downgrading over the next 3 years to only 3 sets versus the currently 4 sets that we run.
If you think about it, the hydraulics, I mean, you've got a hose trailing around the scene behind you all the time. Going with the battery means, we're not corded anymore. You don't have the hoses draped around the scene, coiled around your boots.
Speed and strength. Those are the 2 things
Yeah.
that gives us.
Yeah, one person could carry 2 tools versus 2 to 3 people to carry 1 set of tools to a current incident on the Merritt where it stopped and we're walking up to it.
So how do the batteries charge? Do they charge at the house and then you bring them with the tool, or can you charge them on the truck, or?
They could be charged on the truck, but we also have
Backups.
desk chargers that we can. They come with a second battery, so you would have it.
Yeah.
So routinely, we have a battery off to the side and it's going through its cycle.
Yeah.
And that's good because these are very smart batteries. They know how many cycles they can do, and they know when they're supposed to charge. And very good battery technology in these tools, and even our some of our Milwaukee tools that we maintain also. So getting much more battery life out of everything that we have. The AD's thermal imaging, as we mentioned, the training props, that's the door that we're looking at, the blue door. Again, meets our residential and commercial type of doors that we're up against. Anything else on this year's request? I think I hit everything. Training props, the plumbing and electrical. We have the money for the gear washer, which I was planning to install. We ran into a few snags with the building, and we added a sink. We acquired a stainless steel sink for the lower apparatus floor that we'd like to get plumbed. And to do that, I need also a pump to do that, to get it into the wastewater. I just can't discharge into the floor drains. Not that I was planning to do that with the washing machine, but we definitely can't do that with the sink. So basically what that provides us is a wash station on the bottom floor when we come back with the pickup truck from an incident, that everything could get washed in the stainless steel sink. Got a place to dry it, place to stage it before it goes in for drying. Again, meeting our cancer reduction goals of making sure everything gets washed after significant incidents or training. So that 15,000 is to plumb it, to electric for a pump, because it would have to be pumped up to Main Street. So it goes up to a discharge in between the ground floor and the first floor that goes out to a Main Street sanitary sewer. So that's what that work is, to get that the second washing machine purchased and installed, and the sink at the same time.
And this is just a question for you. With the radio replacement, we're at 40 just with fire. Can we consolidate all the radio stuff with the various departments and then put it in bonded capital? Okay. Yeah. Yeah. We're getting close, and I know we're going to have other
to replace all.
No, but I feel like we're going to have, it's like with Russ and with Russ, we're probably over 50 now.
Yeah, but that would be a rapid amortization, probably a 5-year amortization on the bond, max. Yeah.
Yeah.
But you pay for one way or the other.
Yeah, no, I just, yep. Okay.
And our 5-year, so this year's capital was 1.2 with the current numbers that I brought into the meeting today. Are moving forward with a lot of placeholders. The biggest ones, again, looking at gear, still got a $40,000 placeholder for gear for the next 3 years, because we do have gear coming up on on 10-year service life for PPE. And we have looking at redoing the kitchen floor, added building improvement for FY28 to do a non-porous floor to wash instead of the carpet, which is a potential, kind of a health thing with some of the, walking around with keeping contaminants on the rug if people come in with shoes on. So going to a non-porous floor in the kitchen area and the dining area. Rescue tool replacement, as I said, for 28 and 29 to get to meet everything. We're looking at our goals for rescue tools to replace all the extrication tools. That will include high pressure airbags over the next 2 years, and also adding stabilization struts, replacing current what we have for passenger vehicles and increasing to a heavier strut for commercial vehicles and potential collapses of decks, or somebody hits a column in a building, having the strut to be able to hold that up, or struts to hold that up. And then also for potential another trench incident, they would be able to do to handle those types of stabilization requests also. And then if you looked at right now in FY31, that was the replacement of an engine for FY31. This commission and I can go back and discuss that if we want to move that up, if we need to move that up based on the age of engine 2 and 4. That might be the one that we move up a couple of years to get those engines on my goal would be to get each engine on a 10-year replacement, which pushes the third engine to 30 years. So that's what we need to talk about. But the amount of runs that the third engine goes on and the times it's in service, now that we're doing much better maintenance, we might be able to do that. But we'll talk about that with the commission. But that's where I have it right now.
We'll give you a plan.
Yeah, we'll get the.
We need a plan.
We'll get a better plan.
There's a lot in this, and because I'm looking at this, and it's like, so we have a vehicle coming in. That's great, but then we have one funded this year, maybe another funded in 2 years, and another one
is the ladder truck. That was the ladder truck refund. Yeah.
So, I think we need the whole comprehensive plan.
We can do that.
It's going to be scary.
Yeah, we're trying.
Significant. Let me use that word. Significant.
Well, it's going to be a huge change.
Yeah.
We got to think forward.
And one of ours, we got a lot of stuff that's close together, and some, even though 17-year average, some of them are close together. So that's trying to get on replace it, get a good fleet, but also be respectful to the budget that we're going out and kind of spreading it out over years.
Well, it's just kind of how it works with municipal stuff. You put a lot in and then you're good for 20, 30 years, and then you get this lumpy cost.
We didn't learn our lesson last time.
You get lumpy stuff.
Never do.
That's always the problem, And even out the time shape of money is always.
In different places need different things, just what we do with the buildings and in schools and stuff.
But we can even it out as a town,
We were just talking about that. It sounds like somebody who's been in this.
So yeah, it seemed like we aged back in that time frame where we replaced, and then we said, oh my gosh, we're so outdated, and then we went ahead and did what we're almost gonna have to do again. So welcome to the world of municipality.
Yeah, but in between that, that we fixed that, then we did to like buildings.
Yeah, of course,
that's like you get stuff that lasts 20, 30 years, and then they come back. They're never done forever.
It's just like your house.
I remember as like a 28-year-old young volunteer watching Norm Frame stand up in front of BOS and BOF, with a plan, and back then we did it on an easel with a chart, it was just a line chart. We'll get you something like that.
Those work.
Yeah, I know.
Work.
Just bring us pricing from them too.
Yeah.
And they'll blow the top of
Here's
your head
how
off.
long the lag time is between purchasing and getting. That's crazy.
Isn't it?
Yeah.
Yeah.
It's a major issue.
It's in, and they got the pricing power now, which is a problem.
I didn't say the word collusion.
And again, and it's sound, I mean, everyone looks on websites and it seems like, oh, there's apparatus available out there, but the specs are so particular to us because of the way we back in and out of, back into that firehouse, it really, it limits us on what is available on like just off the lot.
It's in the contract.
Very
We don't
difficult.
pay if it doesn't fit.
Yeah, we don't pay if it doesn't fit. It's in the contract, and right now, because they're so backed up and they know if that truck comes in at the end of the year and doesn't fit, they'll sell it to somebody else next week. And that's it. They had no problem signing that agreement. Okay, if it doesn't fit, then we're not going to charge you for it.
All right.
So.
All right, plan we'll be seeing. That's good.
Thanks, folks.
All right. Tables, well, I'll talk to Ryan on that, what's going on with that. Anything else that I missed that I didn't write down as far as
Yeah, just
That's
the plan. I think your plan is the base.
I mean,
Yeah, your operating budget is reasonable, so. Okay.
Thank
you
you.
very much.
It's silly, but but it's not.
It's a mess. Responsibility. Okay. All right, one more. Might have to take a little break after that. I'd agree. Like the coffee. So I think I can.
Nothing.
Tucker, after this, we're gonna take a quick, yeah, exactly. Just a quick comfort break.
stretch.
Hello, ladies.
Good morning.
So fun. Yeah.
Yeah, that is,
I know. So I heard his daughter, her transplant. It's done.
she's coming home.
So just making sure that it was in.
Yeah, because she was so trying to. Great. Too bad Rita couldn't go out for it.
I know.
You're up.
Good morning.
It's a book size presentation, which is apropos, given what you do.
We always have nice images to share, so we'd like you to have a nice copy of that. It's so interesting to hear about the idea that there's consolidation going on in so many industries.
Yeah.
Even in library world, there's major consolidation going on. Our largest supplier of books and publishing materials went bankrupt this year. And so, yeah, Baker and Taylor. So fortunately for us, we were really well positioned with another supplier, so we didn't suffer in the same way that some other libraries did. But it's endemic.
Is there only like one company that makes books now? Was did I hear that at the
Baker
Maisel thing?
Was the 900-pound gorilla.
Yeah. The great huge industry standard that was a surprise.
Okay. Well, as soon as I can get this to work. Thank you so much. It's so wonderful to see you here today. This is going to be a really quick and straightforward budget presentation. My goal is to just give you a brief overview of what happened during the year. We always have great things to share, but then we want to sort of dive right into the numbers and any questions you might have. And I really want to start by giving you our great thanks for the budget increases that we had last year. You and the other town bodies made a significant impact on the library and its operations this year. And we're very grateful. And I hope that you'll see that in the simplicity of our budget this year, that we're demonstrating our commitment to being effective and conservative stewards of our operational budgets going forward. So in other words, I hope you find this to be a very boring budget. And so with that, I'd just like to take you through a brief recap of some of the highlights of the year, then a few key statistics, and we'll jump right into the numbers from there. Well, let me go back. This image is one of my favorites. This is a picture that you may see in front of you of this beautiful community mosaic project that we undertook. We had a grant from an outside foundation, and we used some of our own operating money to bring in a set of experts to create this magnificent permanent artwork that sits in our mezzanine at the moment. It's gigantic. If you haven't seen it, it's really worth a visit. And what I think is so special about it is that this is an example of the kind of very intentional community building projects that the library loves to undertake. It took 40 volunteers of all ages and several weeks of planning and hundreds of hours of staff time and volunteer time to make it happen. And we call it There Are Many Trees. So we're very proud of this effort. Here's some of the folks that were able to help us on that day, a couple of days. So we've had 1 million people through our doors since we opened in 2023, which is really a wonderful and astounding number for us. We've thought that maybe we were plateauing at some point, but we're still up 5% year over year compared to last year. Perhaps we're starting to see it slow down a bit, but we really we're seeing 1,500 people through the door on average every day. 25 was a year of some pretty significant achievements. I'll go through a couple of them with you now, but perhaps this is one where we gained some international recognition. We were one of 3 finalists for the IFLA Public Library of the Year Award 2025. And I think while we lost to the Canadians, we are in very proud company here. There was a library in China.
Ours is prettier.
Ours is, yeah, well, they each had something to recommend themselves. So I have to say, it was a pretty stiff competition year, but I am partial, of course. This is not only for the design, which was very heavily design driven, but it's also because it recognizes the program of services that we offer. So we are in very exclusive company, and this was a really important recognition for us. We do great things here. We had Eldon Hildebrand. People are knocking down our doors. We had Naomi Watts here. We had Brooke Shields here. We had Ed Burns here. We had Fancy Nancy author Jane O'Connor here. And my personal favorite, we had Peggy Noonan here for a really splendid and very special evening. Great discussion. We honor every year in our conversations with business leaders lecture a New Canaan resident who's a leader in their field. And we've had everyone from Jack Welch to Emily Rubenfeld, who you see here. She's the president of Carolina Herrera, a major luxury brand. And what was so exciting was she brought in this entire team of models and her staff. We had an actual fashion show, which was special and extremely well received. But what I love to see was there were so many young women in this audience who were there to hear her talk about what is it to grow your own career in this particular industry in fashion. It was really a magical occasion for us. We also, on the more serious side of things, enjoyed some talks with Ambassador John Sullivan, former ambassador to Russia, and Saad Mohseni, who's written a book called Radio Free Afghanistan. He is an independent entrepreneur still operating in Kabul today, an independent media network. He was fascinating. There are too many things to talk about in terms of what we do this year. Hopefully, many of you will recognize and see some of the incredible authors and lecturers that we had join us. And I wanted to highlight that the Maker Lab, it's not something we talk about a lot. You may know it. It's that room that is glass enclosed. It's just to the back of our mezzanine. There is so much and varied activity that goes on there. Here you see in the center, Laura Miller, who's our digital services technology librarian. She teaches everything from crafts to technical 3D printing, laser cutting, and there's people of all ages coming into the Maker Lab to learn new skills. So I encourage everyone, if you haven't taken a class that involves Laura Miller in the Maker Lab, to come on in and work with her. Of course, I am personally quite interested in what's going on in our kitchen. we had some fun times this year with Al Roker and others. But what I love to see is that we're doing about 25 adult programs. Eric Thunum is calling me. Should I answer that? He may be looking to be admitted, so I just admitted somebody. You'll do that? Okay, thank you. Anyway, it's great. Again, multi-generational, all ages. There are programs for children and families, and we're doing a lot of work with people who are seeking nutrition advice and just how to cook for themselves. It's really a program of culinary literacy. We don't talk much here about the Lit Lunch and specifically what goes on. As you know, it's our largest fundraiser of the year. I thought I would just share with you a little bit of some slides from this year's event. It was a great success at the New Canaan Country Club. We had Daniel Mason of North Woods. These are just some images to show you how full the room is. And every year, we're so fortunate. We have over 320 people who come out to support the library. It's our biggest fundraiser of the year. It's quite important. And then we also have Groove on the Green, which we are grateful for our sponsorship from Carl Chevrolet and Walter Stewart's Market. But this is a free event that we put on for the community. 900 people were on the lawn this year to hear country music and to have a bit of dance lessons from the people at Fred Astaire. Another popular event that we started last year, we're going to be reintroducing at the end of February. This year was our mini golf for families. We had 700 people come to play mini golf in the freezing cold of February. And my favorite foursomes were the people who turned up like this, who we did not expect to see, but who had a wonderful evening with us. And we're very pleased to do it again. As you know, we are conducting myriad children's programs outside on our green, inside in the building. We are working with partnerships with people who are very active in thinking through what are the needs of the neurodiverse community here in town. And as you know, we have the baby buggy brigade outside our doors every Wednesday, and we're working hard to make sure we're meeting everyone's needs for story times for children. So in terms of the budget last year, the impacts that were achieved, really it comes down to what we thought we needed. And we were able to hire our custodian, Pablo, and we were able to retain key staff. And that was really the main impact for us last year. It was incredibly important, and it has made the world of difference. As you know, we're very busy with our room rentals and our room turnovers. And so having this extra support is critically important for us. We were also able to improve our digital materials and collections, meaning that we were able to shrink those wait times that we spoke to you about last year from sort of a 6-month wait on a digital book to something much shorter than that. Not able to say it on a comprehensive basis, but Cheryl, would you like to comment on?
Yeah, I mean, we've taken them about in half at most. We had a lot of titles that had more than 10 holds per copy, and our goal was to get that down more like 5, and we're there. So that's been a tremendous improvement.
So basically, we're more able to appropriately serve our community given the increase in our public use overall. We were able to counter some of that burnout effect that our staff was experiencing. We were able to retain some of our veteran staff and hire new staff. And also, we've been paying a lot of attention and working hard to stabilize our building and grounds and facilities expenses. So we can talk about that when we get to the numbers, but we're keeping a keen eye on that. Here's just a visual of what our door traffic is looking like. The last bar is showing you a year to date, which is why it looks like it's lower, but we're on track for a 5% year-over-year increase on door traffic. And here again, you see we've been working hard to make sure our collections are circulating and working for us. We are finding that our book print circulation is up 20% since 23. Our digital circulation is up as well.
Hey, Ellen, whatever happened with the movement to, talking about collusion, to reduce the price to libraries for the digital purchases? Did that get through?
So it passed the Connecticut legislature.
But you need another state to
Yeah,
pass
it has a trigger that another state or number of states that have a population of a certain size. Once that similar legislation passes there, then that will trigger the law to go into effect, which just allows us the right to negotiate. So there are
need to negotiate because
So-
it costs you a fortune to get a digital book.
Yes, it does.
Yes.
Yeah.
Yeah. So there are a couple bills. New Jersey has a bill, and I think maybe Illinois, but they're not through yet. So we're waiting.
Darn. Okay.
I think strategy. It's a come along kind of strategy. It's not a go alone, and I think that's intentional, obviously,
Because initial efforts failed
on a solo basis.
yeah.
So simply put, here's our proposed operating budget for the year. The grant we're seeking from the town is $3,119,000. It's representing a 3.5% increase over last year's grant for a total of $105,500. The majority of this, of course, is our salaries. 94% of your grant covers, 100% of your grant covers 94% of our salaries. Again, we're back to just looking at the intense usage of our meeting and study rooms. 50 meetings a day. That's an enormous amount of turnover. What you'll see going forward for us is we've learned a lot in these last few years about how the community wants to use our space. And as we strategically plan going forward for how we use our building as well as the legacy building, this will be an important factor in thinking through what the use case looks like for that new space. We currently find that 90% of the usage of these spaces is taken up by nonprofits and the community. We're working on an optimization plan to ensure that we can really maximize our rental income here. And here's another interesting look. We try to provide this slide every year, comparable to our operating income and sources as compared to our peers. We are in third place. These numbers do include the contributions the town makes to our health insurance. So it is apples to apples for everyone. These are numbers that compare us with our peers on a grant per capita basis. In fourth place here, but we think we'll probably bump up a bit this coming year, which is great. Again, I love to compare our fundraising to our peers. I think we are still the highest ranking fundraiser in the state of Connecticut.
So sorry, Ellen, just stepping back to the operating income and the fully loaded. So that 4.44 million includes health insurance. Okay. And just the health insurance, not the pension benefits.
We don't have, we only have, I think, one person left on the pension.
We contribute to the 403B planning going forward.
I just know we have pension obligations as well. So it's a little bit in excess of the 4.44. Okay.
And that's our entire operating budget, the 4.44. The town portion is the 3.22.
Right. I'm just trying to, I think it's a little confusing because there are your full on loaded costs are higher than what you see because we have costs embedded in the town that are,
it's fair.
Is that the town takes on that you don't reflect in your budget.
Right. But
so I just want to, I just need to, I think it's important for us to really, we had the same conversation with the schools. You have to look at it as a whole. I think the 3,119 is not totally accurate and the budget is not completely. I think we need to update those numbers.
This is the budget and grant. Is that excluding healthcare costs?
It's excluding healthcare and pension costs.
Yeah, so it would be better. It would be better to.
What it includes on our end is the town grant plus the employer provided health insurance.
Yes.
On an basis. So it's at about, I think it was about 412. About 412.
Yeah, and it would be better to reflect the year-over-year increase from that number.
So
the fully loaded last year.
And the 3,119 doesn't include the health insurance costs in it either.
That's right.
So it's almost like they both need to go up.
Yeah, they both. Yeah, you just need.
Okay.
Yeah. I'm not sure we have
We probably need to
project,
work together to get that.
to get it up on the screen.
But
for
then
us
I
to
think
look
if
at.
you can vis-a-vis 2025, which is you guys represented us, which is a reset year, like this is what we have, we need
Right.
custodians and stuff. Then I think you could accurately show the year over year change.
Yeah, and that one will be for 26.
Yeah.
Because
Right. So just go back to last year at the healthcare cost, pension cost, and then reflect that to this year.
Yeah.
And you'll probably be still in the same.
Yeah, same
percentage-
ballpark.
The same percentage increase, right?
We have about the same uptake levels as well. It's about 80% of our staff.
Just be surprised with healthcare. And
We know. You know.
yeah. Okay.
So, again, when we're looking at this slide, which is the fundraising comparison to peers, the obvious and glaring absence for us is the opportunity to draw from our endowment. We are making that a strategic priority for the library over the next 3 to 5 years. All of our peers have substantial endowments that enable them to draw down money to help manage their operating costs. And then I think the last thing I'd just like to reference and mention is planning for the legacy building is underway. We have formed in some committees. We have begun a lot of work around how we see using the space. We're excited for there to be some flexible use, some community use. And I think because we've had the opportunity to be in this building for 3 years and really see what the needs are, it's pretty clear to us how we would want to proceed and make sure that we're meeting the appropriate needs of the community, but also creating an appropriate library use. And so for us, the obstacles there really remain just finalizing some of those details, coming out and speaking with people in wider groups about what we're hoping to be able to use the space for. Funding is definitely something we're going to be hoping to come to you for and ask and working with you to discuss what's possible. We may get there by the next couple of weeks, maybe chat with some of the bodies, but we really do think that we're going to be seeking some help and support.
So, obviously, the sooner you can get that tightened up to bring before either, us before or, Board of Finance at the very latest.
Yeah, otherwise you miss the budget cycle.
No, we're working hard to make that happen. So we've taken a lot of strides, and I think we're in a good place. So we'll certainly be doing that very shortly. So thank you. And if you'd like to go through anything specific on our numbers, we're here to answer those questions.
No, I just, it's good to see sort of a more normalized rate and that we can kind of plan forward with. So
that's right.
I appreciate the, efforts to, bring the budget in a little more reasonably, and after we've seen what the new normalized costs are. So
we did congratulations on stabilizing it and continuing the amazing programming and the utilization of it. Sounds like the custodian made a big difference. Huge.
He's been transformational.
Absolutely. Yeah.
That's good. And I wish you could get some luck on the digital. That would help.
Yeah, when you look at the building and how often it's used, whenever I've walked in there, it's always packed with people. I mean, it doesn't matter what day it is or what day of the week it is. It's amazing how much use that building gets. So it's
I wish you could have seen it, Steve, just last week for the midterms. We extend our hours. Our staff stays late on Sundays for the kids. And we set up tables all over the building, and it's like a gigantic university library study hall. And it's so heartening to see how hard these kids are working. Our staff is providing everything from snacks to even a day of bunnies to come and comfort the kids. Stress bunnies is very sweet. But there's so much thoughtfulness that goes behind this thinking and the programming around it. And we kick some of the adults out to make room for the kids these weeks.
We have a lot of messaging that says these 2 weeks really belong to the high school students.
Yeah.
Hey, you've said that the room usage is amazing, how often those are utilized and used, and it's sort of constant.
I mean, it's 7 to 8 turnover per day per room. That's a lot.
Yeah. a lot of people coming through.
Yeah.
Yeah, I mean, all of us have attended Mike Dinan, the New Canaanite Coffee in the morning, or the mornings he has it, and to see the stroller brigade coming in there with those, I mean, it's amazing how everybody in town has used that library for something, it seems like. I mean, from the youngest toddlers to the oldest retirees, and it's really amazing what you guys are doing over there. So
We presented at the men's club last week. And so, you know, there's about 75, 80 like retired older gentlemen in the room. And so we kicked it off by saying, okay, who here hasn't been to the library? Because I figured it would be a lot. There was not a single man in the room who had not been
That's great.
to the new library. I was
cool.
overjoyed. It was lovely.
well, and you look through the speakers and all the different, you know, everything you could ever imagine is there throughout that year, and it's like bees to honey. I mean, you have to go to see some of that stuff. It's just amazing program. So,
And I think it's also important to say how responsive the staff is to what people are asking for. And that's the absolute essence and nature of librarianship. So if you had a question, Steve, and this came up at the men's club, you're doing a genealogy project for your family. You know, the question came up, how could the library support me? Well, not only through all of our many, many databases, but through the skilled work and support of our librarians who can really help walk people through a process. So library is always the first place to come for advice. We may not be as in-depth as a university library, but there's a tremendous range and breadth of knowledge and willingness. And it's just heartening.
Yeah. So, I mean, even with AI coming into focus so much, everywhere you turn is AI. There's no replacement for that community feel of seeing people, being with people, sitting down, reading material, actual books, you know, written material, being in the coffee shop. It's just something special about it. So hopefully it's going to be there for a long time. So
we certainly hope so.
Thank you both. And look forward to hearing, you know, next plans for the 1913 building. And
we're excited for it. We're very excited to bring it online. It's time. And I think our board is very focused on that.
Wait, you have an anniversary coming up at some point, don't you?
We're 150 in 2027. So wouldn't it be great to get it all done by then? It'd be super.
There you go.
That's great. Right. That's great.
Awesome.
Okay. All right. Thank you.
Thank you very much.
So we're going to take a 5-minute comfort break and be right back. Okay. All right. Welcome back. So the next item on our agenda is the AED purchase. John? More AEDs. And before you get started, I just wanted to have you thank Ryan and the guys for all the work. This has been a little bit of a brutal year.
It's been a brutal year, a lot of weekends. You know, to have what was supposed to be almost nothing on Saturday turn into something didn't help their attitude, but they did a great job. They've been working hard. So thank you. I will definitely convey it.
Somebody's got to get these storms during the week instead of
I know.
Weekends,
It would be nice to have some in the week.
Yeah.
But thank you.
And we get back out of the budget. There we go.
Okay. Good.
Yep, we're good.
So we'd like to enter into a contract with Chris Gardner and Associates LLC to purchase 11 Physio Control Life Pack LP CR2 fully automatic external defibrillators, AEDs, as we're all thinking about them. These would be the same AEDs we purchased, not the same ones, but the same model ones that we purchased in 2022 to replace some other ones that were aging out. These AEDs were provided to the town through a grant from Norwalk Hospital. And they're coming into the end of their life expectancy. We put it in the capital budget to purchase replacement ones because they've run out of grant money.
I always love this. All these grants.
Grants are not free.
That's
Grants
that's
cost
true.
you money down the road.
Yep. And
you had to wind her up.
With this said, though, in this case, it's important. Actually, they're not used very often, AEDs, but one of these AEDs that was from the grant was used and successful. So, the grant originally started from somebody, I believe, from Westport, who an AED was used on and successfully survived. And through Norwalk Hospital, they provided AEDs to a lot of towns. And unfortunately, that grant money is coming to the end. So we'd like to purchase 11 of these to replace ones that are mainly out on our fields.
So yeah, I was going to ask about location. So there's 11 of them. Can you just briefly tell us where?
Yes, like there'll be 2 in Dunning Stadium, one up by the concession stand for the public, and then one down in the field. One by the tennis courts at the high school. One on the outside of Waveney bathroom buildings. There'll be one at the Powerhouse Theater. There's one at Saks Middle School and one at Connor Field. They're external out on the lightning detection. Mead Park at the tennis courts. There's 2 at Irwin Park, one up by the walking trails and one down by the barn. And the last one will be by turf field number 1, mounted on the football storage building there to cover the Capo Field, that section of turf fields.
So these AEDs, we talked earlier with the police about batteries replacements and the lifespan of some of this stuff. Are those boxes, are they plugged in at that location, or are they standalone just sitting there?
They're standalone boxes. The batteries for the AED is not rechargeable. When it needs to be replaced, you replace it. These will be out there during the warm months per se, because they're not effective if it's cold. So we'll be pulling them in for the winter time.
So is this do we use multiple AED suppliers? Like, I mean, are you doing the same company that the police are or the fire? I mean,
not necessarily.
Okay.
We're doing the same company that we used before because I want them to be the same ones we purchased.
Yeah.
There hasn't been any big change in the AED, the model itself. They put on more function or more bells and whistles if you want them. You can tie them into Wi-Fi and they can notify you every day if everything's all right. And that's where we're putting them. Wi-Fi wouldn't do us any, wouldn't help us anything. The one thing we like about these is the pads are universal for both child and adult. So you don't have to, the person using it doesn't have to figure out which pads to grab and plug in. So.
They claim, like, I've never used one of these live, but the instructions are so that anybody can.
That's correct. These talk you through it. Right. You basically get them out of the cabinet, you open it up and it starts telling you what to do, where to place the pads, the whole thing. So.
Wait, Tucker. Yeah, I actually, what I wanted to ask was, where is like a community member? Because in addition to the 911 where they would tell you where it would go, do we have a map that, like, we could put on your website that just shows where all the AEDs are in the community?
We don't.
I mean, 911, they'll tell you if you call 911, but like me as a parent, like, just for knowledge, I'm like, if we have all these resources and we like really don't know unless there's an emergency.
Are they marked somehow in the box, or?
They are marked. The new boxes we will have will be red boxes, and they'll also have a sign above them that says AED, so that you will see them if you're looking for them. With that said, of course, all the police keep them, EMS, of course. Also, all the trainers for the high school.
Good. I was going to ask you that.
Those are the high school trainers, though. So that doesn't do the same thing for, like the sports groups themselves.
But with the youth sports, if there is a map, there must be some sort of, oversight. We have all the, it's like, all, whatever company should have it, all the managers should have it, all the coaches. It's like, it's great if we have them, if we think they're going to help, right? But if no one can find them when they need to, and it's one of those things, they just, if they're just aware, when an emergencies happen, you can respond more quickly. Right. So, so let's make sure, but let's make sure all the people who use our fields know.
Because when you're in an emergency, somebody's having to walk you through, it's at XYZ location, and your brain works differently when you're freezing.
The
Yeah.
first thing you're supposed to do, call 911,
Right.
get the professionals moving towards you, and then go do everything
Right.
else from there.
Yeah, but I mean, I don't know, even something like at the paddle hut, it's in there. You know, it's just like where people, and you don't want to clutter everything with visuals, but you know,
But
think about making sure people know where they are.
This time of year, there is one at the paddle hut,
Mhm.
but during the summer, that one goes to the pool.
Okay.
So we can easily create a map.
That's great.
Yep.
That's great.
Yeah, to your point earlier, they actually have saved lives on the ground. I mean, we have data that supports it, so it's hard to argue.
I've done CPR. I haven't used an AED except for training. So.
All right. Well,
there you go.
If there's no other
budget, right?
Yep.
So-
This is capital budget in the existing year capital budget. Yes.
So if I could get a motion to approve a request from the Parks and Recreation Department to enter into a contract with Chris Gardner and Associates LLC for the purchase of 11 Physio Control Life Pack LPCR2 fully automated defibrillators, AEDs, in the amount of $25,121 plus a contingency of $1,250 for a total cost of $26,300. Why do you need a contingency on defibrillators?
The cabinets aren't necessarily governed price. That's the only reason. And I don't want to have to come back and say, I need a little bit more for the cabinets.
Okay.
This comes with the cabinets. These are.
The quote is including the cabinets. Yes.
So moved.
All right. It's unanimous. Thank you.
You.
All right. Ann?
Good morning.
Morning.
I have 2 POs in front of you that we're looking to get approval on. These are currently in the fiscal year 26 budget. It's the New Canaan Museum and Historical Society for $25,000. That's the total for the year. And the Daycare Center of New Canaan, which is $32,000 for the year.
Well,
Yep, I always do.
yeah. Okay. Any questions?
Nope.
If not, if I could get a motion to approve purchase orders for the New Canaan Museum and Historical Society in the amount of $25,000 and the Daycare Center of New Canaan in the amount of $32,000.
So moved.
It's unanimous. Thank you. And travel request.
The travel request is for, so we put in for a couple of conferences in the year for finance, usually GFOA Connecticut, GFOA National, and we put in for Tyler Technologies, which is Munis, our ERP system. This year, I'm requesting to go to the one in Tyler at the beginning of April. There's a couple of changes that we're doing right now, and this conference does actual training courses. So you're actually sitting there training on the modules and things that they have. So we implemented the contracts module already, but I want to look at, or not want to look at, we're looking to bring payroll in-house, which will enhance our capabilities and our processings that we're doing. So I'd like to get that. And also we have what's called a subledger for our revenue. That's more for continuity planning because there's a lot of manual work done right now. So if someone's out, you lose a lot of continuity. So if we get that sub ledger in there, that's going to keep a different continuity for us for posting our ledgers for finance. So, and there's a couple other modules. IT brought up about how highway tracks their fuel, salt, sand. They do it on a QuickBooks, I believe it is. They have a module as well. So it's getting into those classes to find out what are the capabilities and does it make sense for us to bring them in. So to open up for questions.
Any questions?
So is this mostly, is it training or is it a conference where they're trying to get you to buy new products, you know?
Well, Tyler, we have some of the modules already. We're not even using them.
Yeah.
Okay. So it's, for me, it's implementing those modules we have. Now, the only one that we've recently added was the contracts. We didn't have that one, but we have payroll. We have a different type of contracts one. We have the subledger for revenues. So it's really getting to know, see if it works and actually talk to other people on what they're doing.
A long conference, the 5 days.
I've been to I haven't been to one in 5 or 6 years, but they are, I found it helpful for me finding out what the ERP systems does. Yep.
Yeah. All right, any other questions?
Looks like, so the conference is at the same hotel, so you don't have to move.
Yeah,
around.
I'm coming now because after the end of January, the conference goes up $400 and it's currently 50% on the hotel is like $200 a night.
That's cheap.
Then I'd have to go find a different one that's much higher.
That's good. All right.
All right. If I could get a motion to approve a request from the Chief Financial Officer for a travel request for Ann Kelly Lentz to attend the Tyler Munis Training Conference in Las Vegas, Nevada, scheduled for April 7th through 11th at 2026 at a cost not to exceed $2,600.
So moved.
Second.
It's unanimous.
Thank you.
Thank you. And then Cheryl and Stacy. Wow.
Is he still here?
Yes.
We're in
Still
within the
with
month,
us.
right? Isn't it 20th of February? 27th. Okay, so a little more than a month.
Yeah, a little more
little more than a month.
Okay, so we are here. We have been on the look for a parking manager. We received 55 applications. We set up 9 interviews. We actually only interviewed 4. There was a couple that were ill and 2 that didn't show. We had 3 second interviews, and we would like to present Kevin O'Connor. For those of you who know him, he started working in the town clerk's office 12 of 21. He resigned and left 8/25. He has worked covering Stacy when she has been out in parking and has done a good job doing that. He works well with public and staff. He also worked at the Glass House from 14 to 20. His prior jobs, he's managed staff, interacted with public, and been a manager. And so we had a committee of 4 and we were unanimous with Kevin. Deanna helped us with that at the end. So.
And again, is this another one where we have the employee is on 6 months of
probation? Yep.
Okay,
Yep.
So I just want to make sure I didn't know if managers did that as well. So, okay. Any questions?
So, I mean, he spent some time right down the hallway. So Stacy, you had interaction with him and you think he's a good
Yes,
fit
I
with the
think he will
department?
be a good fit. He is very competent. He's worked well in my office. He's been covering for me when I have been out. I think he knows the people of New Canaan. I think he works well with people in my office as well. He's a hard worker. He will look into things. He likes to learn things, and I think he's a good fit.
Yeah, he seemed to, his ability to help people in the clerk's office was always great. So
Yes.
everybody seemed to really
I
like
think
him
he'll
there, so.
transition well
Good.
too. I think he understands, since he's been there helping, who comes into the office and what he has to deal with as well. So
Yeah, it's a little more stressed job, I think, in terms of people are never in a great mood.
yeah. So I think he's seen some of that already. It will be, a little bit of
conflict
learning
resolution.
with that, but I think he'll do just fine.
Good.
I really do.
So will you guys have some overlap time?
Yes.
That was the hope that we would get somebody in.
That's great.
To
Always, like I've told everyone.
Phone call away.
Phone call away. Yeah. Phone call away.
You're on through the end of February, is that?
Yes.
Yeah,
Mhm.
great. That's great.
It's great to get a lateral.
Yeah.
Someone knows
Yep.
the ropes. It's great.
Worked in the
I know
building and
Kevin
everything
spoke very
about it
well.
as well. The
Yeah,
staff
staff
know him.
really, I mean, staff
everybody,
in the
yes.
building are very complimentary of Kevin in their, interactions with him over time. And, he's got some tech background. So,
Which
given
would be
sort of
helpful.
the increasing technology component to that office, I think it will help because we
He
need,
picked up everything so quickly.
yeah,
So
that's great. That's great.
Excellent. Not that you're replaceable.
No, I know.
Thank you.
It's like that bittersweet, right?
How many years, Stacy, altogether?
Altogether, New Canaan, 23. Went fast.
It really did.
It does. It does. Last few years too.
Well,
Yeah.
town thanks you for everything you've done and all the best. You got a lot of,
Wonderful.
you're going to be busy in your retirement.
Yes, planning on it.
That's
Planning on
great.
it.
All right, if there are no further questions, if I could get a motion to approve the appointment or approve a request from the Human Resources Director to hire Kevin O'Connor at the Parking Authority as manager beginning February 9th, 2026.
So moved.
Second.
It's unanimous.
Thank you.
Thank you.
Thank you.
Thanks, Jason.
Okay, and then the only appointment is actually moving Christina Larson from an alternate member to a regular member on the Planning and Zoning Commission. Paul Canag has resigned his appointment, so we are moving Christina into the space vacated by Paul. We thank Paul for his service to the Planning and Zoning Commission. It is, as we always say, the hardest working commission in the town of New Canaan, and we're thrilled that Christina is willing to continue on in the commission. So if I could get any questions, or if I could get a motion to approve the appointment of Christina Larson from an alternate member to a regular member of the Planning and Zoning Commission for a 3-year term ending December 1, 2026.
So
It's unanimous. And then Tucker, the mileage rate.
Pretty straightforward. Every year, you all just have to approve the mileage reimbursement rate in line with the IRS. So it has gone from 70 cents to 72.5 cents per mile reimbursement.
Okay.
Isn't gas going down?
I know.
I mean, right?
Yeah.
It is.
Just saying. Okay.
It's government, right? All right. If I could get a motion to approve a request to adjust the mileage reimbursement rate for the town business effective January 1st, 2026 from 70 cents per mile to 72.5 cents per mile, in line with the recent change now announced by the Internal Revenue Service.
So moved.
Second. It's unanimous. Okay, and then you have on your tablets the contracts under 10,000. You have any questions? If not, if I can move on to the legal bills. And you'll notice that we're segmenting out the charter revision. And, we're kind of segmenting out different pieces of the legal bills.
Yeah, so you can it calls attention to the different areas.
Yeah. If I don't have any questions, if I could get a motion to approve the legal fees.
So moved.
It's unanimous. Thank you. And then Selectmen's comments. I guess 2 comments. One is that just wanted to, thank both the Interfaith Council and the Methodist Church and Pivot Ministries and gosh, I always hate doing this because I'm going to forget somebody, Dr. Richard Williams for his speech, and ABC House, all the boys who gave their Martin Luther King Day, testimonies. It was, and oh my goodness, I mean, a little biased. Nerva is our organist at the Congregational Church, but this, is it what was his, Roosevelt?
Yeah.
What was his last name?
Critic. Yeah.
Unbelievable.
Yeah.
I mean, it was just one of the most amazing services, and, shout out to all the hard work that everybody did to make that service happen. Steve's always like poking me, like, don't cry, because it is one of those services that gets me a little emotional. I mean, when those Pivot guys walk in, I just it's hard to contain the emotion. So.
Yeah, it's beautiful. I mean, it's just very, very moving. Can't say enough about it.
Yeah.
You walk out of there just so uplifted. It's really, really amazing.
Yeah, it was great. It was great. So it's nice that all 3 of us could be there for that to celebrate. So, and then I just wanted to, as the legal bills reminded me, I just wanted to let all of you know. So the never-ending saga of the RWA purchase or attempted purchase of the Aquarian water assets. We won that in Pura. The RWA appealed the decision to state superior court. Judge Budnick heard the oral arguments. we lost on 2 of the cases. They said that the enabling legislation by the state legislature allowed some of our biggest issues with the acquisition, but we are appealing on 1 other item. So it is going to be going back to Pura. So stay tuned, but I just wanted to keep you guys up to date on where that stands. So we'll be seeing, that's a different law firm that we use for that. But, and again, as I've mentioned, we're in partnership with Town of Fairfield, Town of Westport, and Town of Ridgefield, along with WestCog and MetroCog in appealing this. So that's it. Anyone else want to make a comment on anything? Nope. Okay. So if not, if I could get a motion to go into executive session pursuant to Connecticut General Statutes 1-206D for discussion of the lease of real estate by the town when publicly regarding such lease would adversely impact the price of such lease. I would like to bring into executive session Bill Ostman. Do I have to announce everybody's names in public? I don't know that I do. Let's just, yeah, that's a proposed tenant. Okay. And yeah, I don't think, yeah, and let's just, and then if we could, yeah, and you can go and yeah, I don't even, okay. Just let me know when we're in executive session.
106.
Just wait until, just wait. Motion.
Yes, so moved.
Second.
It's unanimous. Okay, yeah.
We're talking about the Playhouse first, right?
Yeah, so first is Playhouse.
Is this, I think this guy,
He's
so
legit.
promising.
He's totally legit. Okay, so we are now out of executive session, and if I could get a motion to adjourn?
So moved.
Second.
It's unanimous. Thank you very much.